The trauma bay doors blew open at 11:47 p.m., and the sound that followed wasn't screaming, it was silence. 6 special operations soldiers moved through Northbridge Medical Center like a controlled detonation, weapons holstered but hands ready, carrying a man whose chest wound was making a sound no one in that ER wanted to hear. The commander scanned the room once, twice, his eyes cutting past 3 residents, 2 attending physicians, and a charge nurse frozen at her station. "Beacon," he said. Not a question, not a plea. A name delivered like a command. Nobody moved. Nobody answered. Except the woman beside the supply cart, still holding a box of nitrile gloves, who closed her eyes for exactly 1 second before she set the box down and walked forward. And before we go any further, if this story already has your heart pounding, hit that subscribe button right now, like this video, and drop a comment telling me what city or country you're watching from. I want to see how far this story travels. Now let's get into it. The float nurse position at Northbridge Medical Center paid $31,048 an hour, came with no assigned locker, and required Audrey Voss to show up wherever the staffing coordinator decided she was needed that morning. Cardiology on Monday. Pediatrics on Tuesday. The trauma bay on nights nobody else wanted, which was most nights. She had been doing this for 2 years, and in 2 years, exactly 3 people in the hospital had learned her last name. One of them was the payroll coordinator. One was the janitor named Dex, who refilled the vending machines on the 3rd floor. The third was a patient who had died 6 weeks ago, a retired welder from the East Side who had called her Miss Voss every time she came in to check his vitals, the way people from his generation addressed anyone who helped them. Everyone else called her the float, or simply didn't call her anything. She didn't correct them. She had chosen this, in the way that people who have lived through very specific kinds of violence choose quiet. Not because they are weak, but because quiet is what their nervous system requires in order to function without fracturing. Audrey Voss was 36 years old, stood 5'6", wore her dark hair pulled back in a way that was entirely practical and conveyed nothing about her as a person, and moved through Northbridge Medical Center the way water moves through pipes, along the path of least resistance, always going where the pressure directed her, leaving no visible mark. The charge nurse on the trauma floor was a woman named Pamela Gorch. Pamela had been charge nurse at Northbridge for 11 years, which she referenced in conversation approximately once every 40 minutes, and she had developed a specific way of speaking to float nurses that communicated, without any single sentence being technically insulting, that float nurses were a biological necessity in the same way that the cleaning staff was a biological necessity. Essential, probably, but not worth engaging with as full human beings. She handed Audrey assignments with the paper face down, which Audrey had noticed on her 3rd shift and never commented on. "Trauma 2 needs restocking," Pamela said that Tuesday evening, not looking up. "Chest tube kit inventory is low. Dr. Hale has a preference for the 14 French. Make sure those are front-loaded." "Already done," Audrey said. Pamela looked up. "I didn't ask you to do that yet. You ask every Tuesday and Thursday. The supply order comes in on Monday and Wednesday." Audrey kept her voice entirely neutral. "I just worked ahead." Pamela stared at her for a moment with the expression of someone who has been handed a gift they didn't want and isn't sure of the appropriate response. Then she turned back to her station. "Trauma 3 needs a linen change." Audrey went to change the linens. The trauma floor at Northbridge on a Tuesday night had the specific texture of controlled tedium. A 42-year-old man with chest pain that turned out to be musculoskeletal. A teenager with a laceration from a kitchen accident, embarrassed about it, his mother hovering in a way that was making everything worse. A woman in her 60s brought in by ambulance from a care facility, altered mental status, possible UTI. The attending on duty was Dr. Marcus Fenn, who was competent and reasonably kind and had learned to ignore the background hum of Pamela Gorch's institutional authority. The resident was Dr. Tessa Nwole, 28 months out of medical school, fast and confident in the way that residents are before they learn what they don't know. Audrey moved through all of it like furniture moves through a house, present, necessary, unnoticed. At 9:15, the altered woman from the care facility, her name was Dottie, she had a son somewhere in Scottsdale who hadn't answered his phone, began deteriorating in a way that the monitoring numbers hadn't yet caught. Audrey noticed it because of 3 things: the color change around the woman's mouth, the way her breathing had shifted from labored to paradoxically calm, and a very specific sound from the monitor that wasn't alarming but that Audrey had learned in another life meant something different than it appeared to mean. She stepped into the doorway. Dr. Nwoll was at the nursing station 20 feet away. Dr. Nwoll, I think Mrs. Kettner has a pleural effusion developing, left side. Nwoll looked up from her chart with the expression residents develop for nurses who have opinions. Not contemptuous, not exactly, but carrying a particular kind of cautious patience. Her SATs are 94, she's on 2 liters. Her SATs were 97 40 minutes ago. That's within normal fluctuation for her age, and her breath sounds are diminished on the left, not absent, diminished. And she's been on her right side for the past hour, which would mask early fluid accumulation on the left until it crosses a threshold. Audrey kept her voice steady, not urgent, not demanding. She had learned that urgency, in nurses, was read as hysteria. I could be wrong, but I think it's worth auscultating. Wool came in, listened, looked at the monitor, listened again. There was a pause. I'm going to get Marcus, she said. They ended up doing a bedside ultrasound. The effusion was there, not massive, but real and growing, and the kind of thing that in a smaller or less fortunate person's body could have turned into something irreversible by morning. Dr. Fenn ordered a thoracentesis, which went smoothly, and Dottie from the care facility had pink lips again by 10:30. Nobody said anything to Audrey about it. She didn't expect them to. She changed the linens in Trauma 3, restocked the glove dispensers in the hallway, and went on. Dr. Victor Hale arrived at 10:45 for his overnight trauma shift, and the particular atmospheric pressure of the floor changed in the way it always did when he came in. Not dramatically, not with any single obvious shift, but in the way a room changes when someone enters it who believes, at a cellular level, that every other person present exists primarily to witness their competence. Hale was 51, trim in the way of men who keep disciplined exercise habits for reasons related to self-image. And he had a CV that included a trauma fellowship at a hospital in Boston that he found ways to mention roughly 3 times per shift. He was, by most objective measures, a good trauma surgeon. He was also a man who had never in his professional life entertained the possibility that someone below him in the institutional hierarchy might know something he didn't. He glanced at Audrey when he walked past the supply station. His eyes moved over her the way eyes move over furniture. Float night? He said, not quite to her. Yes, she said. He was already past her. The first hour of his shift was routine. The chest pain man was discharged. The teenager got his stitches and left with his mother's hand on his shoulder. Hale managed a consult call, ordered labs on 2 patients, and had a resident present a case in the hallway while he scrolled his phone with one thumb in a way that communicated he was listening without conveying any actual evidence that he was listening. At 11:47, the ambulance bay doors opened from the inside, which was wrong. Ambulances came from outside, not from the interior corridor, and 6 men walked through in tactical gear with a 7th man between them who was not walking but being carried. And the sound his breathing made was the sound of a chest that was doing a partial job at best. The commander was Captain Rhett Bannon. He was 42 years old, and he moved the way people move when they have operated in environments where moving wrong means not moving again. Economical, precise, his eyes going to the corners of the room and the exits before they went to the people. He was bleeding from a graze wound on his left forearm that he had apparently decided not to consider relevant. He scanned the trauma bay with the efficiency of someone running an assessment, and what he found there was Dr. Hale at the center of the room, 2 residents flanking him, Pamela Gorch at the nursing station gripping her tablet, and a float nurse by the supply cart who had gone very, very still. I need a trauma team, Bannon said. He's got penetrating chest trauma, entry approximately 3rd intercostal, right side. Tension pneumo or hemothorax. He's been compensating for about 40 minutes and he's running out of compensation. Hale stepped forward. What happened? Is this I need a trauma team, not a conversation. Bannon's voice was not raised. It didn't need to be. I understand that, but protocol requires beacon. Bannon didn't shout it. He said it the way people say a word they have said many times in a specific kind of situation, concisely, with purpose, aiming it at the room like a signal flare. Nobody answered. Bannon's eyes moved across the room. The residents. Hale. Pamela. The doorway. Back across the room. And then they stopped. They stopped on the woman by the supply cart, who had set down her box of gloves and was already moving. Audrey Voss crossed the trauma bay in 11 steps. Right side, she said, not to Bannon, but to the injured man. Dark hair, mid-30s, face the color of old paste, a compression bandage on his right chest that had done its job for about as long as it was going to keep doing its job. What's his name? Carter, Bannon said. Carter. She put her hand on Carter's face, not gently, exactly, but with the specific authority of someone whose touch communicates that they are in charge now. I've got you. Stay with me. You're a nurse, Hale said behind her. His voice had an edge that was not quite a question. Right now I'm the person in front of the patient. She didn't turn around. I need a chest tube tray. 14 French. They're front-loaded in trauma too because I stocked them this evening. I need ONEG running before we do anything else, and I need someone to call for a portable chest x-ray and then not wait for it, because we're not going to have time to wait for it. You do not have authority to, Dr. Hale. She still didn't turn around, and something in the way she didn't turn around made Hale stop speaking. He has about 4 minutes before his trachea deviates, and then we lose him. I would like to use those 4 minutes productively. The room was suspended for exactly 2 seconds. Then Dr. Nwoll, who had come back in from her chart work and was standing at the perimeter, went to get the chest tube tray. One of Bannon's soldiers moved to the ONEG cabinet without being asked. He clearly knew where blood products were kept in medical facilities, which was its own kind of information. Pamela Gorch stood at her station, making a face that could not quite resolve itself into an expression. Hale said, I am the attending physician on this floor, and I will not— Then attend, Audrey said, and the word landed clean and flat, and she turned briefly to look at Hale for the first time since Carter had been brought through the door. Her expression was not challenging, it was not contemptuous, it was the expression of someone who has made a decision and is past the point of negotiating about it. Stand beside me and tell me if you see something I miss. That would actually be useful. Something crossed Hale's face. It was not agreement, it was not quite anything nameable. But he didn't move forward, and he didn't say anything else, and that was sufficient. Carter's oxygen saturation was reading 88 when Audrey positioned him. She palpated the right chest with 2 fingers. Quick, practiced, the kind of assessment that doesn't perform itself but simply happens. The compression bandage came off. The entry wound was where Bannon had described it, and the wound itself told her things, the angle, the track, the way the tissue around it was behaving. She had seen injuries like this in conditions that made this trauma bay look like a well-lit luxury hotel, and the part of her brain that had learned those things in those conditions was now, without her permission, but also without her resistance, running the assessment the way it had always run assessments, fast, specific, without ceremony. Hemopneumo, she said, not explaining, because she wasn't narrating, she was diagnosing. He's got air and blood both. The tension component is going to kill him before the blood loss does. And Wohl had the chest tube tray open. The ONEG was running. One of Hale's residents, the younger one, a third-year named Park, who was watching everything with the focused attention of someone realizing that medical education is very different from medicine, had gloved up and positioned himself to assist without being asked, which Audrey noted and approved of without commenting on. I need lidocaine for the local. We're going to do a needle decompression first, then tube placement. Standard procedure is to, Hale began. Standard procedure is designed for patients who have time. Carter, she said again, because she'd found that using a name kept people from going somewhere she couldn't follow. I'm going to do a needle now. You're going to feel pressure on your right side. That's the right thing to feel. Carter's eyes found hers. He was past speaking, but his eyes were still working, and what was in them was the specific quality of attention that people have when they understand they are at the exact boundary between one thing and another, and they have decided to trust the person at the border with them. She did the decompression. The rush of air was immediate and, in its own clinical way, satisfying. The sound of pressure releasing, of a body reclaiming function that had been stolen from it by physics and bad luck, and someone else's hostility. Carter's oxygen sat moved, 88 to 90 in under a minute. His color shifted, fractionally, towards something more consistent with a living person's color. Tube, she said. Past it. The resident held the field. Audrey worked. She was aware, on some peripheral level, of Bannon standing behind her, not hovering. He wasn't a man who hovered, but present, in the way that soldiers stand when they are watching something they have been waiting to see confirmed. She was aware of his 5 teammates at the perimeter of the trauma bay, most of them watching Carter, one of them watching her with an expression she didn't have time to interpret. She was aware of Pamela Gorch calling someone on the phone in a low voice, probably administration, probably framing what she was seeing in a way that would be difficult for Audrey when this was over. She was aware of all of it the way she was aware of ambient temperature, as background information that had no bearing on the present task. The tube went in, drainage began. Carter's next breath was audible to everyone in the room, and it was a real breath. Not the shallow compensatory effort his body had been making, but the breath of lungs doing their job. "There it is," the resident Park said quietly, almost to himself. Audrey stood up. Her gloves were bloody. Her hands were completely steady, and she hated for one moment that they were, because it reminded her of who she had trained herself to be and all the reasons she had spent 2 years trying to be someone else. He needs imaging and a surgical consult for the chest. There's going to be internal bleeding that the tube won't address. I want serial pressure checks every 5 minutes and someone watching that drainage output. She stripped the gloves. If his pressure drops below 80 systolic, whoever is covering this needs to know immediately. She said whoever is covering this because she was a float nurse. And the moment the immediate crisis had a floor under it, her authority dissolved back into the institutional structure that had never formally granted it. Dr. Hale was standing 4 feet away. His expression was the expression of a man who has been watching something happen that he does not have the correct framework to process. "The chest x-ray," he started. "Already ordered," Inwool said, and there was something in her voice that had changed since the beginning of the shift. Bannon stepped forward. He was looking at Audrey, and his expression was not the expression of a man who has been surprised. It was the expression of a man whose expectation has been confirmed. "Beacon," he said again, but this time it wasn't a call into an empty room. It was something else. Recognition. Something like relief. Audrey looked at him. "I'm a float nurse at Northbridge Medical Center," she said. Her voice was steady. "My name is Audrey Voss." "I know who you are," Bannon said. "Then you know this conversation should wait." He nodded. He understood the hierarchy of crises. He had spent his career inside it. Audrey turned back to Carter, whose oxygen saturation was now holding at 94, whose color had crossed the line back to viable, whose chest was moving with the regularity of someone who was going to need surgery in the next 2 hours, but was no longer going to die in the next 2 minutes. She checked his pulse. She checked his drainage. She pulled the blanket up because temperature regulation mattered, and because sometimes small things were what kept a body deciding to stay. "You're okay," she told him. "You're going to need surgery, but you're okay right now." Carter's hand moved. It was the smallest gesture, fingers curling towards something to hold, the involuntary motion of someone whose body is frightened even when their mind is quieting. Audrey put 2 fingers against his palm without thinking about it, because in the life she had before this one, that was what you did when someone was alone in their fear and you could not fix the fear, but you could be present to it. She felt Hale behind her. She felt the shape of his silence, which was a different shape than the silence he'd had at the beginning of the shift. She didn't turn around. "I need someone to call OR and tell them we have a hemopneumothorax with likely internal hemorrhage, penetrating injury, right chest, male, approximately mid-30s. She looked at Inwool. "Can you do that?" "Already on it," Inwool said, and she was gone. The soldiers had moved to the wall, giving the space that the situation required, but they hadn't gone anywhere, and the weight of their presence in the trauma bay was specific and concentrated. One of them, young, dark-skinned, a scar along his jawline that curved the way scars curve when they come from close range, was watching Audrey with an expression that sat between gratitude and something that was trying to become a question. Bannon had stepped back, but he hadn't stopped watching her. Pamela Gorch came across the bay. She had her administrator face on, the face that lived above the charge nurse face, the face that involved different muscles entirely, the muscles responsible for institutional liability. "I need to speak with you," she said to Audrey. "I'm with a patient. The patient is stabilized. The patient is stabilized pending surgery, and I'm monitoring his vitals until OR is ready." Audrey looked at her. "After that?" Pamela's jaw tightened. This is a conversation that needs to happen. I agree, Audrey said. After. Pamela retreated to her station. The next 18 minutes were the particular kind of quiet that follows an emergency that has been successfully contained. Not restful, not resolved, but paused. Audrey checked Carter's pressure at 5-minute intervals. She watched his drainage output. She noted the moment his eyes became more focused, when the pain started to make it through the shock and register as a thing he was experiencing rather than a thing happening to someone adjacent to him. She got him 2 milligrams of morphine ordered through Fen, who had come back in from somewhere and taken one look at the room and understood, at least partially, what had happened, and who signed the order without making it a conversation. At the 12-minute mark, Carter spoke. His voice was raw and thin, and he had to try twice before it worked properly, but he got there. "You're her," he said. Audrey was writing the vitals on the chart. She didn't look up. "I'm your nurse for tonight." Bannon said. He stopped. Breathed. The breathing was painful, and he made no sound about it, which told her something about the life he'd been living. He said Beacon would be here. Bannon was being optimistic. "He's not usually wrong." Audrey capped her pen. She looked at Carter, who was looking at her with the eyes of someone who is measuring distance in the particular way that people measure distance when they are in debt to someone, trying to calculate what they owe and whether they will ever be able to pay it. "You need to rest your voice," she said. "Your body just went through a significant insult, and the surgery is going to take whatever reserves you've been building. Rest now." Carter's eyes stayed on her for a moment longer. Then he closed them, or called up at the 22-minute mark. They were ready. The transport team came in. Audrey gave her handoff to the OR nurse. Detailed, specific, the kind of handoff that the OR nurse was clearly not accustomed to receiving from a float nurse, and her expression showed it, and watched Carter's bed roll through the bay doors. The soldiers shifted. One of them moved to follow. Bannon stayed. Pamela was already crossing the floor. "My office," she said. "You don't have an office," Audrey said. "You have a supply closet with a desk." It wasn't cruel, it was just accurate. "The conference room, then." Audrey pulled off her outer layer gloves and dropped them in the appropriate disposal. She looked at Bannon, who was standing with his arms at his sides and his eyes on her with the patience of someone who has been waiting for something for a long time and is willing to wait a little longer. "I'll find you," she said. He nodded. "We're not going anywhere." She followed Pamela to the conference room that served as administrative overflow space, with its folding table and its single motivational poster about teamwork that someone had hung slightly crooked and no one had ever straightened. Pamela closed the door. Dr. Hale was already inside, leaning against the far wall with his arms crossed and his expression organized into something that was trying to be authority but kept slipping into something rawer and less comfortable. "You performed a medical procedure without physician authorization," Hale said. "I performed an emergency intervention when the attending physician was not moving to address an immediate life-threatening condition," Audrey said. "That is not your—" The patient's oxygen saturation was falling. He had signs of tension pneumothorax. Every second of delay increased mortality risk. "I acted within the scope of an emergency nursing intervention, and I will document it as such." "You placed a chest tube," Hale said. "That is not—" "The decompression needle was within my scope. The tube placement was performed under circumstances where delay would have resulted in patient death, and I will defend that decision to whatever board you choose to bring it to." She kept her voice even. Not angry, not afraid, just exact. "Dr. Hale, I understand that what happened tonight was irregular. I understand that it created problems for you institutionally. But Carter Hale—" She stopped, looked at him. "Carter, the patient, is alive. He is in surgery and he is alive, and that is the outcome this hospital is supposed to produce." Hale's expression did something complicated. He uncrossed his arms. "I'll need an incident report," he said, but the edge was gone. "I'll file one tonight." Pamela had been watching this exchange with the expression of someone who came to a meeting expecting to control it, and has realized that the dynamic in the room is different than projected. She straightened her tablet. "This will go to administration," she said. "There are questions about your qualifications." "Good," Audrey said. "I would welcome that review." She left the conference room. In the corridor, she stood against the wall for 30 seconds. She breathed. She was aware of her own heartbeat, which was elevated. Not from the procedure, not from Hale, but from the specific and unwelcome feeling of being seen, of having the covering dark of the float nurse life peeled back by a single name shouted across a trauma bay by a man she hadn't expected to see again. Bannon was waiting for her at the end of the corridor, near the bay window that looked out onto the ambulance drive. The rest of his team was further down, a cluster of men doing what soldiers do in waiting: quiet, conserving, alert. The parking lot lights came through the glass and laid themselves across the floor in long, pale rectangles, and Bannon stood in one of them and watched her come toward him. "How did you find me?" she said. "We've known where you were for 14 months. He said it without apology. "We just didn't have a reason to come. And now you do." "Carter knows something," Bannon said, "about an operation. Something that people with resources have been trying to make sure he never gets to say to the right people." He paused. "Whoever they are, they know we brought him here." Audrey felt the particular cold that is not about temperature. "They know where he is," she said. "Yes." She looked down the corridor toward the OR. Carter was in there somewhere, chest open, a surgical team working to finish what she had started. And somewhere outside this building, someone had just been informed of his location. She looked back at Bannon. "Then we have a problem," she said. Bannon's expression didn't change, but his hand moved to the radio on his vest. "We have a very specific problem," he said, "and you're the only person I trust to help me solve it." The specific problem had a shape, and the shape was this: Carter Hale, no relation to the doctor, a coincidence that Audrey had already noted and filed away, was the only living witness to an operation that had gone wrong in a country whose name was not going to appear in any report that reached a standard desk. He had seen things. He had documentation, the kind that lived on encrypted drives and in the specific architecture of human memory. And there were people who had invested significant resources in ensuring that memory never reached anyone with the authority to act on it. Bannon laid it out in the corridor in 4 sentences, which was the appropriate length for a briefing in a situation where time was a resource being spent. "They had eyes on the extraction point," he said. "They made us at the airfield. We changed the destination twice in the air, and they still found us here, which means they have better intelligence than we'd like." He looked at her. "Carter wakes up from surgery. He's a target in a hospital bed. How many people know which OR he's in?" "Surgical team. Charge. Whoever Gorch called when she was on the phone during the procedure." He said it without inflection. "Your charge nurse made a call." Audrey thought about Pamela Gorch at the nursing station, phone low, voice lower, face doing the specific arithmetic of institutional self-protection. It wasn't malice. It was probably just Pamela being Pamela, informing someone above her in the chain before the situation could become something that arrived at their desk without warning. But the information had traveled somewhere, and they didn't know where it had landed. "The OR is on the 4th floor," Audrey said. "Single corridor access, 2 elevators, 1 stairwell on each end." Bannon looked at her for a moment. "You memorized the building." "I work every floor. I know where the choke points are." She said it simply, not performing anything. If someone wanted to reach Carter while he's on the table, they'd need to get through scrub check at the OR entrance. That's controlled. Recovery is different. Recovery is one large bay with multiple access points and staff rotating in and out all night. "That's the window." "That's the window," she agreed. Bannon turned to look down the corridor toward his team. The young soldier with the jaw scar met his eyes, and something passed between them that wasn't spoken. Bannon turned back. "I need to position 2 of my guys near the recovery entrance without creating a situation that gets them removed by hospital security. Talk to Dr. Fenn. He's the overnight attending, and he's not going to love it, but he's reasonable. Tell him it's a security matter related to the patient's identity and keep it vague." She paused. "Don't talk to Hale." "Noted." A pause. "And you?" "I'm the float nurse," she said. "I can be assigned anywhere. Pamela doesn't want me in her eye line right now anyway, which means if I request the recovery bay for the rest of the shift, she'll probably grant it just to have me elsewhere." Something crossed Bannon's face that might, in different lighting, have been something close to a tired kind of appreciation. "You've gotten very good at operating inside systems." "I've gotten very good at being invisible inside systems." She started walking toward the nursing station. "That's different." She had the conversation with Pamela in under 3 minutes. As predicted, the charge nurse agreed to the recovery bay reassignment with an ease that confirmed she wanted Audrey away from trauma, away from Dr. Hale's orbit, and away from whatever administrative unpleasantness the night was generating. Pamela was a woman who managed problems by moving them to other rooms, and right now Audrey was a problem, and the recovery bay was another room. Audrey didn't correct the framework. She took the assignment and went. The recovery bay at Northbridge at midnight was a long room with 12 bays separated by curtains. L-shaped nursing station at the center, and a particular quality of light, lower than the OR, lower than trauma, the light of a room designed for the suspended state between crisis and safety. 3 patients in various stages of waking from anesthesia. A post-hip replacement in Bay 4 who was trying, groggily, to ask a nurse about her car. A young man in Bay 7 recovering from an appendectomy who kept saying his mouth felt like chalk, which it did. And Bay 12, at the far end, where Carter would come when OR released him. Bay 12 was currently empty. Audrey moved a supply cart to the position where she could see both the curtain and the service entrance at the end of the room. She began inventorying the cart, because a nurse inventorying a cart is the most invisible thing in a hospital, and invisible was what she needed to be while she watched. 2 of Bannon's men came through the main entrance 20 minutes later. They were in street clothes now. How they had street clothes available was a question she didn't ask, and they positioned themselves with the unremarkable purposefulness of people who do this for a living. One sat in the small family waiting area adjacent to the bay entrance. One stood near the vending machine in the outer corridor. They were not invisible exactly, but they were ordinary enough. Hospital waiting rooms at midnight were full of men in civilian clothes who looked like they were monitoring something. It just usually wasn't this specific. Bannon himself was somewhere between the 4th floor and the OR corridor. He'd told her he'd stay mobile. At 1:15 a.m., Carter came through from OR on a gurney, the transport nurse giving handoff to the recovery RN, a woman named Sula, who had the compact efficiency of someone who had done this shift for 15 years and had made peace with all of it. Sula checked Carter's dressings, his lines, his airway. He was still intubated. They'd planned to wean him in recovery, and then looked up and found Audrey at the supply cart. "Float?" Sula said. "Audrey, yeah." "Can you take 12? I've got 9 and 11 both restless and 4 needs another assessment." "I've got 12, Audrey said. She moved to his bay and pulled the curtain to its working position. Not closed, not fully open. She checked his lines. His color was reasonable, which meant the surgical team had done what needed to be done with the internal bleeding. His chest rose and fell with the rhythm of the ventilator, and she watched it for a moment longer than necessary, not because she doubted the equipment, but because in the life before this one, she had learned not to trust equipment alone. His hand was the same as it had been in the trauma bay. Large, scarred along the knuckles in the pattern of someone who had worked with their hands in environments that didn't protect them. She didn't touch it this time. She just noted that he was alive, which was a different kind of information than it sounded like. At 1:40, she became aware of a new person in the recovery bay. He hadn't come through the main entrance. He had come through the service corridor bound, the one that connected the supply elevator to the back of the bay, the one that staff used for linen and medication cart deliveries, and that was, technically, badge access only, except that the magnetic reader on the service corridor door had been malfunctioning intermittently for 3 weeks, and the facility's work order was still pending. She knew this because she worked every floor and she knew where things were broken. The man was in scrubs. Not OR scrubs. Those had a specific cut and the Northbridge logo on the left chest. These were generic, the kind you could buy at any medical supply store, and they were slightly wrong in the way that clothing is slightly wrong when someone has put it on quickly without checking the details. He was carrying a medication tray, which was also slightly wrong, because medication trays at 1:40 a.m. in recovery came from pharmacy with a specific color-coded cover, and this one didn't. He was moving toward the far end of the bay, toward Bay 12. Audrey stepped away from the supply cart. She didn't run. She didn't call out. She walked the line of the bay at the pace of a nurse moving between patients, which was unhurried and purposeful and completely unremarkable. And she put herself in front of Bay 12's curtain at the exact moment the man in the wrong scrubs arrived at the other side of it. He looked at her. She looked at him. "Bay 12 is my patient," she said. The man said nothing. He was in his 40s, thick through the chest, with the kind of stillness that wasn't relaxation. "Can I help you with something?" she said, and kept her voice the voice of a nurse who has encountered a confused orderly. Mild, professional, giving him a chance to be someone who was just lost. I wasn't. His hand moved and she moved before it finished moving, stepping into his space rather than back from it. Because stepping back meant the gun, if it was a gun, had room. And stepping in meant it didn't, and she had her forearm against his before the tray was fully dropped, and her hand on his wrist in a grip that she had learned in a place very different from this recovery bay, at this quiet hour of this ordinary night. The tray hit the floor. The sound was specific and wrong, and Sula looked up from Bay 9. The man was strong. He got his arm free and he moved fast, faster than she'd have guessed, and she took a hit to the shoulder that spun her into the curtain rail, which bent under her weight and held. She got her footing back and saw that he was going for the bay rather than for her now. Carter was the objective, not her. And she stepped across the bay entrance again, and this time she picked up the IV pole from beside Carter's gurney because she needed reach, and it was there. The man from Bannon's team who had been in the waiting area came through the curtain from the far side. Fast. He hit the man in the wrong scrubs from the left, and the two of them went into the wall between bays 11 and 12. And the sound brought Sula fully up from her station, and one of the recovery patients started making noise from Bay 9, and the whole quiet machinery of the midnight recovery bay began to come apart. Bannon was through the main entrance in 30 seconds. His other man was behind him. The man in the wrong scrubs was on the floor with his hands behind his back, the soldier's knee in his back, and he was done. Not by virtue of being soft, but by virtue of being one person with two of Bannon's team on him, and the arithmetic of that situation was conclusive. Audrey set down the IV pole. She turned to Carter's gurney. The ventilator was cycling. His lines were intact. The hit to her shoulder was already becoming something she was going to feel more clearly in an hour, but right now it was just information. She looked at Bannon. 3 weeks, she said. The service door lock has been broken for 3 weeks. Bannon looked at the downed man, then at her. His expression was the expression of someone recalibrating something. You need to get building security, and you need to get your people to every access point, she said. And someone needs to tell OR to check whether anyone flagged Carter's surgical bay location in a system that has external access, because that's how he knew which room. How do you know he knew the room? He went straight to Bay 12. He didn't check any other bay. She pulled the curtain back into its working position. He had the information. Bannon was already on his radio. Hospital security arrived in 4 minutes, which was 2 minutes faster than Audrey had expected, and told her that Bannon's men had already been in contact with them. The man in the wrong scrubs said nothing, which was consistent with what he probably was and who had probably sent him. Building security took custody. Someone was going to have to make calls to people above Bannon's pay grade, and the ripple of that was going to hit this hospital in ways that hadn't been felt yet. Sula, who had watched the last 90 seconds of this, with the compressed expression of a woman who had not signed up for whatever this was, looked at Audrey across the recovery bay. What, Sula said slowly, was that? A security incident, Audrey said. Patient in 12 is under protection. Can you document the service corridor access as a facilities issue and flag the lock repair as an immediate priority? Sula stared at her. The IV pole was already there. I moved it. She went back to the supply cart. Do you want me to call facilities, or can you? Sula called facilities. The rest of the recovery bay resettled the way disturbed water resettles, slowly, with evidence of what had disrupted it still visible in the pattern. The patient in Bay 9 needed reassurance and an adjusted dose of anti-anxiety medication, which Audrey got ordered through the overnight physician on call. The IV pole went back beside Carter's gurney. Audrey documented the vitals she'd collected before the disruption and added the notation about patient security concerns in language that was specific enough to be accurate and restrained enough not to set the chart on fire. At 2:30, Bannon came to stand beside the supply cart. I owe you an explanation, he said. You owe me several. She was writing. But Carter comes first. He's stable. Surgical team says the repair held. He'll be off the vent by morning if everything goes the way they expect. It might not. It usually doesn't. He said it without self-pity, just as a statement about the nature of their shared experience. He leaned against the wall the way people lean against walls in the middle of the night, when they are tired in ways that sleep doesn't fix. His knee. She looked up from the chart. The reason you left, he said. I always thought it wasn't just the knee. She held the pen and said nothing for a moment. Outside the bay window, the parking lot lights were doing what they'd been doing all night, laying their pale geometry across the concrete, indifferent to everything happening above them. It was the knee, she said. And what came with the knee? The Arden Valley thing. She set the pen down. We're not doing this here. I know. He straightened off the wall. But I want you to know that what happened at Arden Valley, the official report, the way it got written, Bannon, was wrong. People in this building knew it was wrong, and they wrote it the way they wrote it anyway, and you wore that for 3 years. Audrey picked up the pen. I wore it for longer than that. He was quiet for a moment. The ventilator cycled in Bay 12. That's why Carter matters, Bannon said. What he knows, what he has, it includes what happened at Arden Valley. All of it, not the version in the report. He paused. The version that actually happened. She heard him. She heard everything that was in what he was saying, and she felt it move through her the way things move through people when they have spent a very long time carrying something heavy, and someone has just told them the weight might not have been theirs to carry. She didn't let that show. He needs to survive to say any of it, she said. That's why we came here. You came here because you needed a trauma medic you trusted and you knew I was here. She looked at him directly. That's fine. I understand that. But if there's more coming for him tonight, I need to know what we're dealing with, because whatever walked through that service door was not a lone individual making a solo decision. Bannon nodded. There's more coming. How much more? He looked at her for a moment. In the low light of the recovery bay, with his face showing the accumulated toll of the past several hours, he looked like what he was, a man who had been keeping several things from collapsing simultaneously for longer than a man should have to. The person who wants Carter silent has connections inside the DoD, inside 2 federal contractor networks, and apparently inside at least 1 hospital administrative system, based on how fast that man found the right bay. He said it evenly, the way people report facts that are frightening when reported in a frightened voice, and are slightly more manageable when reported in a level one. We're not talking about a private actor. We're talking about someone with enough reach to access a hospital's surgical scheduling records in under 2 hours. Audrey thought about Pamela Gorch on the phone. She thought about the way information traveled through institutional systems without anyone meaning harm by it, just information flowing the way it flows, finding its level. Who did Gorch call? She said. We're working on that. Work faster. She looked at Carter in Bay 12. He's off the vent by morning and into a regular room, which means more access points, more staff rotation, more ways in. If something is coming, it comes before he's moved. Bannon was already pulling out his phone, and then it rang before he could dial anything. He looked at the screen. She watched his expression change, not dramatically, but the specific way a face changes when it receives information that is several levels more serious than the information that was already serious. He answered, said nothing, listened for 15 seconds. Copy, he said, and ended the call. He looked at Audrey. 2 vehicles just entered the hospital parking structure, he said. 4 individuals apiece. They're not here for emergency services. Audrey looked at Carter. She looked at the recovery bay exits. She ran the geometry of the building in her head the way she had learned to run it. Corridors, stairwells, elevator banks, the service tunnels in the basement that connected the original structure to the East Wing addition, the loading bay that emptied onto the service road behind the hospital, the generator room that sat between them and the only exit on the north side. 8 people, multiple access points, a hospital with 2/3 of its night staff unaware of what was happening on the 4th floor. How long before they're inside, she said. My guy says 8 minutes, maybe 10. She looked at him. Carter can't be moved, she said. Not safely, not tonight. She heard herself saying it and heard the next thing before she said it, the thing she had spent 2 years in a float nurse's scrubs specifically trying not to have to say. So we don't move him. Then what do we do? We hold the floor, she said. And I need you to tell me everything you have right now because in 8 minutes I need to understand exactly what is coming through those doors. Bannon held her gaze. Beacon, he said. Don't, she said. You need a trauma medic who knows this building and you need to brief me in the time we have. She was already moving toward the nursing station, so start talking. He started talking, and what he said in the next 4 minutes changed the shape of everything she thought she'd understood about the night, about Carter, about the operation at Arden Valley, and about the reason that 2 years ago, someone with access to military medical records had made a very specific decision about what version of Audrey Voss would appear in the system from that point forward. She listened. She walked. She pulled a building schematic from the maintenance binder at the nursing station that she had memorized 3 months ago on a Tuesday shift when there was nothing else to do. And when Bannon finished, she stood with the schematic in her hand and the weight of what she'd just been told settling into her the way cold settles into bone. Slowly, thoroughly, without dramatic announcement. "They didn't just redact my file," she said. "No. They replaced it." "Yes." She looked at the schematic. She looked at the clock above the nursing station. 2:47 a.m. She looked at Bay 12. "Who authorized that?" she said. Bannon's expression was the expression of a man delivering a fact he has been dreading delivering. "The name in the authorization chain," he said, "is Hale." Audrey was still for 1 full second. Then she turned to look down the corridor toward the trauma floor, toward the man who had been standing in the trauma bay when the doors blew open and had watched her save Carter's life with his arms crossed and his face arranged into the expression of someone witnessing an inconvenience. "Victor Hale," she said. "Victor Hale," Bannon confirmed. The clock on the nursing station wall read 2:48, 6 minutes. 6 minutes was not enough time to do everything that needed doing, so Audrey stopped thinking about everything and started thinking about sequence. First, Carter could not be moved, but Carter could be made harder to find. Recovery Bay 12 was at the end of the room, and its bay number was on the intake board at the nursing station entrance, which was visible from the doorway. She went to the board and changed it. Bay 12 became Bay 7. Bay 7's patient, the appendectomy, stable, sleeping, got a new notation. If someone came through that door with a list, the list would send them to the wrong curtain. It bought maybe 90 seconds. 90 seconds was a resource. Second, Sula. Audrey went to her at the station and spoke quietly and directly. "There is a security situation developing. The patient in the last bay is a target. I need you to take the other patients and move them to the inner corridor staging area and stay there with them until someone tells you it's clear." Sula looked at her with the expression of a woman who had 15 years of night shifts behind her and had developed an accurate instrument for detecting when a situation had crossed the line from manageable to something else. "Are you serious?" "Yes." Sula looked at the bay, looked at Bannon's men at the perimeter, looked back at Audrey. "I'm going to need this explained to me thoroughly afterward." "I'll explain everything afterward. Right now I need you to move." Sula moved. She was efficient about it, waking patients carefully, speaking in the low, steady voice of someone who manages anxiety in others by not exhibiting it herself, guiding the hip replacement and the appendectomy and the third patient, a woman post-laparoscopic procedure who was barely awake, into the inner corridor with a competence that Audrey noted and filed as the specific kind of thing that doesn't get recognized enough. Bannon had been on his radio. He came back to her position near the nursing station. "My team is at the stairwells, north and south. The elevator banks are covered. If they're coming up from the parking structure, they hit the ground floor corridor first. My guy down there has about a 90-second window to identify them before they reach the elevators." "They won't take the elevators?" Audrey said. "Why not?" "Because elevators are a box. You're contained, you're lit, you're visible. And if someone is waiting at the top, you have no options." She looked at the schematic. "They'll take the north stairwell. It connects to the parking structure on level 2 through the covered walkway, and it's the only stairwell that doesn't require passing the main security desk." Bannon looked at the schematic, then at her. "You've been planning exits in this building. I've been working here for 2 years. I know where every broken lock is, and which stairwells have cameras that work, and which ones have cameras that are cosmetic." She folded the schematic to the relevant section. "The north stairwell camera has been offline since October. Facilities knows. It's on the same work order as the service door." "Same work order." "Budget cycle. They batch them." She handed him the schematic. "North stairwell, 4th floor exit, puts them into the corridor 40 feet from this bay entrance." Bannon took the schematic, looked at it for 3 seconds with the focused efficiency of someone who can read spatial information quickly, and got on his radio. The exchange was brief. Then, "I've got one man on the north stairwell, fourth floor exit. One on the south is across coverage. That leaves me one for inside the bay." "And you?" "And me. That's 3 people and 2 entry points into this room, plus the service corridor, which we know is already compromised." She looked at him. "What do you actually have?" He was quiet for one beat. "Fewer resources than the situation calls for. We weren't expecting the hospital to be the target environment." "No," she said. "You expected OR to be a controlled handoff and recovery to be a quiet watch." She wasn't reproaching him. She was just saying the shape of the miscalculation aloud, because understanding the gap between expectation and reality was the first step to bridging it. "What else is in this building that I can use?" "Use for what?" "For making the 4th floor an environment that people who are not supposed to be here find difficult to operate in." She was already moving, back toward the supply cart, and her hands went through the inventory with the quick indexing motion of someone who has restocked this cart enough times to know it by touch. "I'm not talking about weapons. I'm talking about the building." Bannon watched her for a moment, and then he understood what she meant, and he got back on his radio. The north stairwell emergency lighting was on a manual override panel in the facility's control room in the basement. Bannon's man in the basement hit it at the 301 mark. The north stairwell went from standard fluorescent to the specific dim red of emergency mode lighting, which was functional enough to navigate but not enough to assess threats clearly, which meant anyone moving through it was moving through a constraint. It was not nothing. The service corridor access from the supply elevator, the same entrance the man in wrong scrubs had used, had a secondary lock, a deadbolt that required a physical key rather than the badge reader. Audrey had found that key 8 months ago in the back of the supply closet when she was reorganizing during a slow Tuesday, had noted its location, had never thought about it again until now. She got it from the closet and locked the service door from the inside. The bay entrance from the main recovery corridor had a set of double doors that were normally held open on magnetic catches. Audrey released the catches. The doors swung closed. They weren't locked. They couldn't be locked from this side. That was a fire code issue. But they were closed, and closed doors slow people by 2 seconds, and 2 seconds was a resource. Bannon's man inside the bay, the young one with the jaw scar, whose name Audrey had learned in the past hour was Doyle, had positioned himself behind the nursing station console with a sight line to both the bay entrance and the curtain at the far end where Carter lay with his ventilator cycling and his body doing the slow arithmetic of survival. At 3:04, Bannon's radio produced a specific kind of static followed by 2 words from his ground floor contact, "They're in." Audrey was standing at the nursing station. She picked up the internal hospital phone and dialed the security desk. "This is the night nurse in recovery on 4, she said. "I have an unauthorized personnel report. 4 individuals, non-staff, entering through the north corridor. They are not patient families and they are not lost." She kept her voice calm. She did not say words that would cause the security desk operator to redirect the call to an administrator. She said words that would cause the security desk operator to send people. "I need immediate response to the 4th floor north corridor." She hung up before they could ask her to stay on the line. Security at Northbridge was not a tactical unit. They were 4 overnight guards, 2 of whom were currently in the emergency department dealing with a separate situation involving a combative patient. The remaining 2 would respond to the 4th floor call, which meant Bannon's people would not be the only bodies in the corridor, which complicated the math for anyone trying to move through that space invisibly. Not a solution. A friction point. Friction points accumulated. She went to Bay 12. Carter was as she had left him. Intubated, sedated, vitals on the monitor showing the specific numbers of a body that had been through significant surgical trauma and was handling it the way bodies handle it when the repair was done correctly and the variables cooperate. She checked his lines. She checked the drain, which was still outputting the expected color and volume. She stood beside the gurney and felt the particular weight of standing between something fragile and something coming, and she recognized the feeling with the specific clarity of someone who has felt it before in circumstances that made this moment look tame by comparison, and circumstances that made this moment look like its own specific version of impossible. The double doors at the bay entrance opened. They opened slowly, which was wrong. People who belong in a place open doors with the momentum of belonging. These doors opened with caution, which meant the people opening them were assessing the room before committing to it, which meant they already knew what the room contained and were thinking about vectors. Doyle, behind the nursing console, was still. The kind of still that isn't passive. 2 men came through. Not 4. 2. Which meant the group had split. Which meant the other 2 were at a different entrance. Which meant the service corridor. The service door, Audrey said, not loudly. Bannon was already moving. He went through the internal door to the medication room that connected, through a secondary passage, to the service corridor. Audrey heard rather than saw what happened next. Footsteps, a collision, something hitting a wall, and then a sound that was neither person speaking but communicated the resolution of an immediate physical contest. In the bay, the 2 men at the entrance had stopped moving when they processed that the room had changed from what the board outside indicated. The board had said 7, and they were seeing 12 bays and a specific arrangement that didn't match their information. 2 seconds of recalibration, which was 2 seconds Doyle used. What happened in those 2 seconds, Audrey did not watch directly, because she had turned back to Carter and put her body between his gurney and the entrance, because the one thing she could do that nobody else in the room could do was be the last obstacle between a man on a ventilator and the people who had sent someone in wrong scrubs to stand over him with a medication tray that didn't come from pharmacy. She heard the room resolve. It took 11 seconds, and it was loud, and something glass broke. And one of the men said something that was not a word but a sound. And then the room was quiet with the specific quality of quiet that follows something physical. She turned around. Both men were on the floor. Doyle was standing. He had a cut along his forehead from something. The corner of the nursing console or the edge of a monitor, it was hard to tell. And he was bleeding in the way of head wounds, which looks much worse than it usually is. And he met her eyes and said, "I'm fine." Because people who are catastrophically not fine usually don't say it in that voice. She looked at the men on the floor. Alive. Both of them. She noted this without commenting on it. Bannon came through the internal door. He also had blood on him, his left arm, reopened from the earlier graze, which was a secondary problem to manage after the primary problem stopped evolving. "Service corridor is clear," he said. "1 in custody." "2 here in custody." "2 here," Doyle said. "That's 3, Audrey said. "You said 8 people in 2 vehicles." Bannon's expression confirmed what she was already calculating. 5 unaccounted for, she said. His radio went. His man on the north stairwell. 5 words, then silence. Then 2 more words that made Bannon's jaw tighten in the specific way that jaws tighten when a situation upgrades. "They split 3 ways," he said. "The other group didn't come up. They went down." "Down," Audrey said. "Basement." She thought about the basement. She thought about what was in the basement of Northbridge Medical Center at 3:07 in the morning, and she thought about the facility's control room, and she thought about Bannon's man in the basement who had been managing the lighting override, and she thought about one other thing. "The hospital records server," she said. Bannon looked at her. "IT infrastructure is in the basement. The server room is behind the facility's corridor." She felt the shape of it resolving as she said it. Carter's surgical records, his admission records, the intake documentation. She paused. If someone with institutional access helped route his location through the hospital system, the evidence of that access is in the server logs. And if that evidence points where you think it points, they're not here to kill Carter, Bannon said. The realization arriving at the same time in both of them. "Not primarily," she said. "Carter in a hospital bed is a problem, but Carter in a hospital bed with evidence in the server logs of who accessed his records and when, that's a different problem. They're cleaning the trail. And Carter is secondary. If they get the server logs, the access trail disappears, and the man who used his position to route that information never has to account for it." She looked at the door, then at Doyle. "Can you hold this bay?" Doyle assessed his own situation. Head wound, functional, both hands working. "Yes." "Then I need to go to the basement." "You are not," Bannon started. "I know this building, and your man in the basement is 1 person facing 5, and he does not know the layout below the first sublevel because that part of the basement is not on the standard building map." She looked at him directly. "I have been in the sub-basement 6 times because the linen delivery for the 4th floor comes through a tunnel access that starts in sublevel 2, and I helped Dex with a cart once and got the full tour." She picked up her security badge. "I know where the server room is, and I know how to get to it faster than they do because they're navigating from the main basement corridor and the server room doesn't connect to the main corridor directly. There's a secondary passage through the old equipment storage that cuts the route in half. Bannon stared at her for one moment. The moment was brief. He was a man who had learned to evaluate information quickly and act on it. "Stay on comms," he said, and clipped a radio to her scrub pocket. "Channel 3. "What's the frequency?" "It's already set." She went. The basement of Northbridge Medical Center at 3:09 a.m. had the quality of all hospital basements, a different species of building from the floors above, functional and unglamorous, and full of the infrastructure that the patient-facing spaces depended on and never acknowledged. Audrey moved through the main basement corridor at a pace that was quick without being running, because running in a corridor you don't know the other occupants of is a way of announcing yourself. She passed the linen storage, the pharmacy receiving bay, the electrical room with its permanent low hum, and then she took the turn that was not marked on any signage because it led to old equipment storage that predated the East Wing renovation and had been left as a dead-end utility space that people with business there knew about and everyone else passed by. The passage through the equipment storage was narrow and poorly lit and smelled of industrial cleaner and the specific damp of concrete that has been cool and underground for 50 years. She moved through it in the dark for 30 feet with her hand on the wall because she had been this way twice, and the layout was in her head in the way that spatial information lodges when you have learned to keep it. The server room was on the other side of a fire door at the end of the passage. She could hear, when she reached it, that the fire door was not latched. The pressure seal was off, meaning it had been opened recently and not fully closed, which meant someone had come through from the other side. She stopped. She was not armed. This was a hospital, and she was a nurse, and the thought of being armed was not something she had entertained when she put on scrubs at the start of the shift. And the absence of that option was a concrete fact that she managed by not spending more than 1 second acknowledging it. She had a radio, she had the layout, she had the specific quality of attention that comes from doing dangerous things in dangerous environments and surviving them often enough to learn something from each one. She pressed the radio. "Bannon, Channel 3. Static. Then, go. I'm at the server room fire door. Someone is inside. Your man? Where is your man?" A pause. "Lost contact with Reyes 4 minutes ago." Reyes. That was the man in the basement. Lost contact meant something specific, and she didn't let herself spend time on the specific thing it might mean. "I'm going in," she said. "Wait for—" She went in. The server room was a long, narrow space. Server racks on both sides. The constant white noise of cooling systems. Red indicator lights along the racks creating the same low-red environment as the emergency-lit stairwell. 2 men she didn't recognize were at the terminal at the far end. One was at the keyboard. One was standing watch, and he was the one who turned when she came through the door. There was a third person on the floor by the second rack. Reyes. On his side, not moving, but she could see his chest from the doorway, and it was rising, which meant the calculation was different than it would have been otherwise. The standing man started toward her. Audrey moved left, into the narrow space between the first server rack and the wall, because the standing man was larger than her, and the corridor between the racks was too narrow for that size advantage to operate efficiently. She had 2 feet of space and a rack of server equipment, and the understanding that the objective was not to win a fight, but to create enough disruption to stop the man at the terminal from completing what he was doing. She grabbed the cable management arm from the front of the server rack beside her. It was a hinged metal bar, tool-free removal. She knew this because she had been in this room with Dex's cousin who was an IT tech and had explained things she'd half listened to on a slow afternoon that now resolved into exact relevant knowledge. And she swung it at the standing man, not to injure him, but to intercept his reach, because his reach was the immediate threat. He knocked it aside. It hit the rack and made a sound. He grabbed her arm. She twisted with the grab rather than against it. You cannot outstrength the grip from a larger person if you try to pull directly away from it, but the grip has a direction, and if you move in that direction faster than the person expects, the grip becomes a fulcrum. And she came in under his arm and put her elbow into the junction of his neck and shoulder. Not a strike exactly, but a pressure point application that her body remembered from training that her conscious mind had put in a box 3 years ago. He went down on one knee. She was already past him, moving toward the terminal. The man at the keyboard stood up, and he was faster than he looked, and he had her by the collar, and she felt herself go backward, and her shoulders hit the server rack behind her, and several things on the rack protested with the sound of equipment that has been bumped by a human body unexpectedly. The cooling noise was constant and white and enormous in her ears. She had both hands on his wrist. She looked at the terminal screen over his shoulder. It showed a progress bar. The progress bar was at 71%. Deleting, overwriting, whatever it was doing, it was 69 seconds from completion at the rate it was moving. "Stop," she said, and she said it the way she said it to patients whose bodies were doing something their minds hadn't consented to. Not a request, not a threat, just a word she placed in the room. He didn't stop. The man on one knee was getting back up. Audrey made a decision. She stopped trying to fight the man holding her and instead turned her full attention to the terminal. She couldn't reach the keyboard. She could reach the power strip on the floor beneath the rack, the one the terminal and its associated peripherals were running through, because she could see it under the desk, and her foot was 8 inches from it. She kicked the power strip. The terminal went dark. The progress bar disappeared. The work that had been 69 seconds from completion stopped at 71%, which meant 29% of whatever evidence lived in those logs still existed, which was not nothing, which was in fact everything. The man holding her collar said something that was not a word and tightened his grip. The fire door opened behind her. Bannon came through it with his 2 remaining team members, and the arithmetic of the server room changed completely. And finally, the man holding her collar made the calculation that most people make when the arithmetic changes that way, and he let go. Audrey straightened. Her collar was stretched. Her shoulder from the earlier impact in the recovery bay was broadcasting its opinion loudly. She walked to the terminal, to the blank screen, to the keyboard, and she hit the power button. The system came back up. The progress bar was gone. The deletion process had not completed. She looked at the screen for one moment. "You need someone from IT with forensic clearance in this room right now," she said, "and you need them before anyone else in this building makes a call that results in this terminal being accessed by someone who wants to finish what got started." Bannon was already on his phone. Not his radio, his phone, which meant the call was going somewhere above the hospital. Reyes was sitting up. He had a laceration above his right ear and the expression of someone who was reassessing the current situation through significant post-concussive recalibration, but he was sitting up and his eyes were tracking, and when Doyle, who had apparently followed them down, said his name, he responded to it. Audrey crouched beside him, 2 fingers to his pulse, pupils with her pen light, which she always had because it was a basic assessment tool, and she was a nurse and nurses carried them. Left pupil, reactive. Right pupil, reactive. "What's your name?" "Reyes. Mateo Reyes." "Do you know where you are?" He looked around the server room. "Somewhere I didn't expect to be tonight." "That's accurate. Can you tell me what happened?" He told her in short sentences. "Hit from behind," which explained the location of the laceration. "Went down fast. Came back up after a minute or so. Couldn't find his radio, which they'd taken. Been lying still trying to assess what was in the room." "Good instinct," she said. "Good instinct and bad outcome aren't that different from where I was." "You're upright and talking," she said. "That's the outcome we want." She stood. Bannon had finished his call. He stood with the phone in his hand and looked at her across the server room, past the 2 men on the floor, whose disposition was now Doyle's problem, past the dark terminal with its 29% intact, past Reyes sitting up against the rack, and doing his own quiet recalibration. "That call I just made," Bannon said. "Who was it?" "People who have been waiting for a reason to look at a specific set of records for 14 months. He paused. "They'll be here by morning." "What kind of people?" "The kind that come with credentials that override everything in this building." He looked at the terminal. "And subpoena authority." Audrey looked at the terminal. She thought about the access logs. She thought about the name in the authorization chain. She thought about Victor Hale, who was somewhere in this building, who had been in the trauma bay when those doors opened, who had stood with his arms crossed while she saved the life of a man whose location he may have routed to people who wanted him dead. She thought about Arden Valley, about the report that had been written wrong, about the version that lived in Carter's encrypted files, and in his memory, and in 29% of a server's deleted logs. "Bannon," she said. "Yeah." Hale is still on shift. He looked at her. If he knows this didn't work, if he knows the server wipe didn't complete, he'll run. Bannon's expression moved. She could see him calculating. Or he won't run, she said. He'll do something else. Because someone like that, someone who has been managing this for the length of time he's been managing it, doesn't just run when one operation fails. He has contingencies. What kind of contingency? Audrey looked at the ceiling, toward the floors above them, toward the recovery bay on 4, toward the patient in bay 12 with his chest drain and his ventilator and his 29% worth of surviving evidence. Carter, she said. Bannon moved before she finished saying it. She was right behind him, and they were through the fire door and into the passage, and Bannon was on the radio saying things she was only half hearing because the rest of her attention was on the layout of the building between the basement and the 4th floor and the fastest way to cover it, and they hit the stairwell, the south stairwell, full lighting, no one on it, and they went up. 3rd floor, 4th floor. The recovery bay doors were as she'd left them, closed on their magnetic catches. Doyle's voice came through the radio. Bay is clear. Patient is stable. I'm the only... Then a different sound. Then silence. Then, in the radio, a voice that was not Doyle's. Audrey knew the voice. Victor Hale said, over Doyle's radio, "Tell whoever is coming up the stairs to stop. I'm in the recovery bay and I'm standing next to your patient, and I think we should have a conversation before anyone makes a decision they can't take back." Bannon stopped on the stairwell landing. He looked at Audrey. His face had the expression of a man receiving information that confirms the worst version of a thing he'd hoped was the second worst version. She took the radio from his hand. "Dr. Hale," she said. A pause. "Voss," he said. And the way he said it, the specific weight and texture of her name in his mouth, the fact that he knew it, the fact that he said it without surprise, told her something she hadn't known for certain until this moment. He hadn't just authorized the file replacement. He had known exactly who she was from the moment he walked onto his shift and found a float nurse working the trauma bay. He had known. "I'm coming in," she said. "I wouldn't," he said. "You're standing next to a ventilated patient," she said, "which means you need both hands to do anything to him, which means you are not holding anything else, which means the threat you're implying is not the threat you can actually execute." She paused. "I'm coming in." She pushed the double doors open. Victor Hale was standing beside Bay 12. Carter was as she'd left him, intubated, sedated, lines intact. Doyle was on the floor near the nursing station, not unconscious, she could tell from his position, but incapacitated by something. A wrist at a wrong angle. He'd been disarmed in a way that required close-quarter skill that she hadn't attributed to Hale until now, but was recalibrating on in real time. Hale looked at her. He was in his white coat, which was incongruous in the way that the wrong scrubs had been incongruous earlier. Someone wearing the clothing of a role they were no longer performing honestly. "You should have stayed invisible," he said. "I'm not very good at it," she said. "It turns out. You were excellent at it for 2 years. I had a reason." She walked toward him slowly, not rushing, not stopping. The specific pace of someone who has decided to close distance and is doing it deliberately. "What did you tell them at Arden Valley?" His expression shifted. She watched it happen. "The report," she said. "My file. You put your name on an authorization that rewrote my service record. I want to know what you told them to justify it." "That is not a conversation for—" "Carter is going to wake up," she said. "He's going to wake up, and he's going to say what he knows. And the IT forensics team that is coming to this building in the next few hours is going to reconstruct 29% of a deletion that didn't complete. And the people coming with subpoena authority are going to ask you the same question I'm asking you right now." She was 10 feet from him. "I'm asking you first because I'd like to hear you say it." Hale looked at her. He looked at Carter. He looked at the bay around him, the curtains, the monitors, the double doors where Bannon had appeared and stopped, reading the room the way he read rooms, letting her lead it. Something in Hale's face moved. Not remorse. She didn't think that was what it was. Something more like the specific exhaustion of a man who has been holding several things together for a very long time and has just realized that his grip has failed and the things are falling and he is watching them fall. "You weren't supposed to be here," he said. "Not that night. Not the Arden Valley operation." "I was reassigned at the last hour," she said. "I know that." I reassigned you, he said. The recovery bay was very quiet. I put you on that operation, Hale said, because I needed a medic with your specific skill set, and I didn't have anyone else. And what happened there, what went wrong, I needed it written a certain way to protect an asset that was worth more than one operation's after-action report. He paused. You were the variable I could adjust. You rewrote my record, she said. You made it look like I made errors. I made it look like the outcome was attributable to field decisions. Yes. And Carter was there. Carter was there. Carter saw the original reports before they were adjusted. Carter kept copies. Something moved in Hale's face again. Carter has been a liability for 14 months. And you sent people to fix that liability. I authorized the management of a security risk, he said. And the language was the language of someone who has spent considerable time making a thing sound like something other than what it was. Audrey was 5 feet from him now. You sent people to kill a patient in a hospital, she said. In my hospital. Hale looked at her. And you rewrote my record, she said. And you gave me 2 years of being no one. 2 years of pushing a cart and restocking gloves and having people look through me like I was a piece of furniture because you needed a variable, and I was the most adjustable thing in the room. Voss, I'm not finished. She stopped, 3 feet. You stood in that trauma bay tonight with your arms crossed and you watched me save his life, and you knew the whole time who I was and who he was and what bringing him here meant. I was trying to assess the situation. You were hoping he'd die before I got far enough along. She said it simply, not as accusation but as the statement of a person reading a sequence of events. When he didn't, you went to the conference room and you started building an institutional case against me because if you could have me removed from the floor, Carter was isolated. And then the server was the next piece. Hale said nothing. Behind her, Bannon had his phone out, recording or transmitting or both. She didn't ask. She kept her eyes on Hale. It's over, she said. Hale looked at Carter. He looked at the monitor that was showing Carter's vitals, steady and persistent and entirely indifferent to the events occurring around it. He looked like a man who has run the calculations and arrived at a number he doesn't want to accept. Then he looked at Audrey, and something in his face became specific and focused in a way that made the back of her neck do the thing it did when situations shifted from resolved to not resolved. And she realized in the same instant that Hale's right hand had been at his side the entire time they'd been talking, and she had not been watching it closely enough because she had been watching his face. He moved. Not toward her. Not toward Carter. Toward the monitor. She understood in the half-second before it happened what he was reaching for, and she moved, and the monitor cart tipped and the alarm line pulled free, and the ventilator alarm began to sound its single sustained note into the recovery bay, and Audrey's hands were already on the reconnection before the sound had fully registered in the room, and Bannon was through the curtain, and Hale was against the wall with Bannon's forearm across his chest, and the ventilator line was back in its port, and Carter's monitor returned to its numbers within 4 seconds. 4 seconds was an eternity. 4 seconds was nothing. Carter's vitals were unchanged. The disconnection had not been long enough to matter. The alarm continued for 3 seconds after reconnection because that was how the system worked, and then it stopped, and the recovery bay was quiet again. Audrey stood with her hands on Carter's ventilator line, and she breathed. She heard Bannon behind her, and she heard what he said to someone on his phone, and she heard Hale's voice change in the way that voices change when a person understands their options have concluded, and she heard Doyle making his way upright from the floor near the nursing station, profane and stubborn and functional. She stood with her hands on Carter's ventilator line, and she looked at Carter, who was breathing, who was going to keep breathing. She stayed there for a long time, long enough that Bannon, when he came to stand beside her, said nothing because there was nothing to say. The building around them was making its night sounds, the sounds of a place that had just been through something and was in the process of not knowing how to resume its ordinary behavior. At 3:51 a.m., Carter's monitor registered a change, not a crisis, not a deterioration, a change. His fingers moved, his blood pressure shifted fractionally upward. His eyes, still closed, moved beneath their lids with the specific motion of someone whose brain was returning from somewhere and finding, with some surprise, that the body it lived in was still available. Audrey watched it happen. And then her radio clicked, and the voice on the other end was someone she didn't recognize, a voice with the specific timbre of institutional authority arriving from outside, the kind of authority that did not announce itself loudly because it didn't need to. This is Special Agent Deanna Tark, Federal Investigations Unit. I'm in the Northbridge Medical Center parking structure. I have 4 agents with me and a federal warrant authorizing access to all hospital record systems, personnel files, and security documentation. A pause. I'm looking for someone named Beacon. Can someone tell me which floor I want? Audrey looked at the radio. She looked at Bannon. He was watching her with an expression she had not seen on him before. Not the operational focus, not the exhausted patience, but something underneath both of those things that was waiting, quietly and without pressure, to see what she would do. She pressed the radio. 4th floor, she said. Recovery Bay. I'll be here. Special Agent Deanna Tark was not what Audrey had expected, which was probably the point. She was 53, compact, with close-cut gray hair and the kind of face that had settled into its permanent expression over years of looking at things that required an accurate read. Not warmth, not coldness, just precision. She came through the recovery bay doors with 3 agents behind her and a 4th staying in the corridor, and she took in the room in about 4 seconds. Hale against the wall with Bannon's arm across his chest, Doyle on his feet and bleeding from his head wound, Carter in Bay 12, monitors running. She looked at all of it, and she looked at Audrey, and she said, "You're Beacon." "I'm the night float nurse," Audrey said. Tark looked at her for one more second. "Right." She turned to her agents. "Secure Dr. Hale. Get medical for the man with the head wound. And someone call the IT forensics team in the basement and tell them to stop touching anything until our people are with them." Things moved quickly after that, with the specific quality of efficiency that arrives when institutional authority walks into a room that has been running on improvised authority for several hours. It wasn't better, exactly. Bannon's people had kept Carter alive and the server logs partially intact, and Hale from completing whatever he'd intended at the monitor. But it was different. The weight redistributed. Audrey felt it happen, and felt, underneath the redistribution, a specific kind of tired that she had been holding at arm's length since 11:47, and that she now let come a step closer. Tark's agents cuffed Hale. He went without resistance, which she noted. Men who fight at the cuffing stage are men who think the situation is still recoverable. Men who go quietly have done a different calculation. Hale had done the calculation and arrived somewhere that looked, on the outside, like composure, and was probably something closer to a controlled collapse. He looked at Audrey once as they took him past her. Not with malice, not with appeal, with something she couldn't name cleanly. The expression of a man who has spent years watching someone carry a weight he placed on her and is now watching her set it down. And the watching costs him something specific that doesn't have a simple name. She didn't say anything. There wasn't anything she needed to say to him right now that the next several hours wouldn't say more precisely and with more consequence. Tark positioned herself at the nursing station with a tablet and 2 case folders that one of her agents produced from a bag. She was the kind of person who had the documents ready before the situation resolved, which meant she had been building toward this night for longer than tonight. "Walk me through it," Tark said to Audrey, "from when the doors opened. You want the medical events or the security events?" "I want the sequence. You decide what's relevant." So Audrey walked her through it. She was direct and specific, and she didn't editorialize, because editorializing was a way of telling someone what to think about the facts. And Tark was clearly someone who had strong opinions about what she thought and didn't need assistance. She covered Carter's admission, the chest tube, the recovery bay breach, the server room, Hale's admission in this room, the monitor disconnection. She left out the parts that were about her own internal experience, because those weren't evidence and they weren't Tark's concern. When she finished, Tark made a note on her tablet without looking up. The conversation with Hale, the one where he described his role in the Arden Valley report modification. Yes. Captain Bannon was recording. "That's between you and Bannon." Tark looked up. "You knew he was recording." "I knew it was possible. I didn't ask him to stop." A pause. Tark made another note. "The server deletion was at 71% when you interrupted it." "Yes. 29% remaining. Our forensics team is working the reconstruction now. What they've pulled in the last..." She checked her watch. 40 minutes is consistent with what you've described. Access logs showing a query to the surgical scheduling system at 11:58 p.m. The query used an administrative credential assigned to the Northbridge Medical Center Trauma Department. She looked at Audrey. Assigned specifically to Dr. Victor Hale. Audrey had known it. Knowing it and hearing it confirmed were different experiences. She absorbed the difference without showing it. His credential, Tark continued, was used to access Carter's admission record, pull the OR assignment, and route that information through an external relay to a contact we've been tracking for 14 months. She set the tablet down. This is the operational link we've been building toward. Carter's testimony plus the access logs plus Hale's recorded admission tonight. That's a case. Against Hale. Against Hale? Hale and the people above Hale. Tark held her gaze. There are people above Hale. I assumed. A contractor network with DoD connections. 2 individuals in senior oversight positions who have been managing the Arden Valley situation from the institutional level since the original operation. Tark paused. Your service record modification was one piece of a larger pattern of documentation management. You were not the only person whose file was adjusted. Audrey sat with that for a moment. The specific weight of not being the only one. How many? She said. We've identified 6 personnel records that show evidence of post hoc modification following Arden Valley. 3 of those individuals left service. 2 are still active and don't know what was done to their files. Tark's voice was level. One of them is you. I'm not active. You're functional, Tark said, which was a specific word choice that Audrey recognized as deliberate. There's a distinction. Bannon appeared at the edge of the nursing station, having concluded whatever he'd been managing with his team in the corridor. He looked at Tark, then at Audrey. Reyes? Your man is with our medical support, Tark said. Concussion. He'll be evaluated and transported. Bannon nodded. He looked like he'd been awake for approximately 36 hours, which was probably accurate. He sat down in the chair beside the station because that was what his body had decided without consulting him. And he sat in it the way people sit in chairs when they are done with the part that required them to be standing. At 4:20, Dr. Fenn arrived on the floor in civilian clothes, which meant someone had called him at home. He came through the recovery bay doors with his coat half-buttoned and his hair the wrong shape, and his face organized into the expression of a man who has been told enough to want to be present, but not enough to understand what he was walking into. He stopped inside the doors and looked at the federal agents and Bannon's team and Hale's visible absence and Doyle sitting at the nursing station with a pressure bandage on his head and Audrey beside the nursing station in the same scrub she'd been wearing since the start of her shift. What happened to my hospital? He said, not quite as a question. There's going to be a full briefing, Tark said. But the short version is that a patient was targeted by individuals connected to a federal investigation. The threat was contained and we have a physician in custody. She paused. Your hospital held. Ben looked at Audrey. She didn't say anything. There wasn't a version of this that she could summarize in a corridor at 4 in the morning that would do the night justice, and she was too tired for the attempt. Carter, Fenn said, stable. Vitals have been consistent. He started showing signs of coming around about 40 minutes ago. She checked the monitor in Bay 12 from where she stood. They'll wean the vent this morning. Fenn looked at the bay. He looked at Tark. He looked at Bannon, who gave him nothing, and at Doyle, who gave him a tired nod. He looked back at Audrey. I need to understand what happened tonight, he said. I know, she said, but right now I need to stay with my patient. He accepted that. He was a reasonable man, and reasonable men, when they are told a clear boundary by a person whose face says the boundary is not negotiable, accept it and find another entry point. He went to talk to Tark, and Audrey went back to Bay 12. Carter's fingers moved again at 4:35. Both hands this time, the slow exploratory movement of someone whose body is reasserting its inventory. His blood pressure had been climbing by increments since 3 a.m., not alarmingly, appropriately, and his oxygen numbers were stable enough that the respiratory therapist on call had already flagged him for a weaning trial later in the morning. Audrey stood beside his gurney and did the things a night float nurse does beside a patient's gurney in the specific quiet that arrives after everything has resolved and before the day shift begins to hear about it. She checked his drain. She documented his vitals. She straightened his blanket because it had been disrupted at some point during the night, and the edge was uneven and cold air at the edges of a surgical patient's covering was a small and manageable thing she could address. She was straightening the blanket when Carter's eyes opened. Not all the way. The way eyes open when anesthesia is still in the system and the brain is voting on whether full consciousness is a reasonable investment. They opened to about a third, and they found the ceiling first, and then they found her. She waited. "Still here," he said, or tried to say. The tube was out from earlier in the morning. The vent team had done a brief spontaneous breathing trial at 350 that he'd managed without assistance for 22 minutes before they'd re-intubated for safety margin, but his throat was raw and the words came out abraded and thin. "Still here," she confirmed. He blinked. Processing. The thing with the ventilator, it was reconnected in 4 seconds. Your vitals didn't deviate. He closed his eyes. She thought he'd gone back under, but he was just processing. She could tell from the way his face was doing it. "Hale," he said, "in federal custody." She kept her voice the same voice she used for post-surgical patients. Not clinical, not gentle exactly, just even. Present. "Agent Tark is in the building. You'll speak to her when you're medically cleared." The files. 29% of the server logs are intact, plus your copies, if they're where you said they were. A pause. He hadn't told her where his copies were. He'd barely spoken to her, in fact, since the trauma bay. She felt him make the connection and let it settle. "Bannon," he said. "Bannon told me enough." Carter's eyes opened again, further this time. He looked at her with the specific quality of attention that comes from a person who has been in situations where the difference between surviving and not surviving was another human being's decision, and who is looking at the human being whose decision it was. "Why did you stay?" he said. "After the first thing, the chest tube. You could have—" "I'm the night float nurse," she said. "This is my shift." He looked at her. "Get some rest," she said. "The questions will keep." He didn't argue. He closed his eyes again, and this time the quality of closing was different. Not the closing of someone going under, but the closing of someone who has made a decision to rest in a situation where rest is available, which was its own kind of trust. At 5:15, Pamela Gorch arrived for her shift handoff. She came through the recovery bay doors in her day shift scrubs with her tablet and her face in its default configuration, and she stopped when she saw the agents and stopped again when she saw Audrey, and the 2 stops were different in character. "The night float nurse," Pamela said, and her voice was doing something complicated under its surface. "Yes," Audrey said. Pamela looked at the federal agents. At Doyle, who was still at the nursing station and had declined transport twice. At the bay where Carter lay, vitals stable, breathing on his own. At the chart that Audrey had been keeping since 1147, which was comprehensive and specific and accurate in the way that charts are when the person writing them knows what they're documenting and why it matters. "What needs handoff?" Pamela said. It wasn't quite the question she normally asked. It was the question of someone who has walked into a room that changed while she wasn't watching and is trying to take its new dimensions. Audrey walked her through it, patient by patient, bay by bay. Carter last. She covered the vitals, the chest drain, the weaning trial, the expected timeline for the morning. She covered it in the level and specific language of a nurse doing a handoff, because that was what this was, and because doing it correctly was the correct thing to do regardless of everything else the night had contained. When she finished, Pamela was quiet for a moment. "Agent Tark wants your statement before you leave," Pamela said. "She asked me to tell you when I came up." "I know." Another pause. Pamela's face was doing something that wasn't comfortable to watch. The specific expression of a person who understands that they made decisions during the previous night that are going to be visible in daylight and doesn't yet know how visible they'll be or what they'll cost. "The call I made," Pamela said, "last night, when the soldiers brought the patient in." "Yes." "I called the hospital administrator on call. Standard protocol for unusual admissions." "Who is the administrator on call?" Pamela named someone. The name meant nothing to Audrey, but she watched Tark, who was 15 feet away and clearly within earshot, make a note on her tablet without looking up. Pamela didn't see it. Audrey didn't indicate it. "It was protocol," Pamela said, and the word protocol landed differently than it would have 12 hours earlier. "I know," Audrey said. "You'll need to tell Agent Tark exactly what you said and who you called and what time." Pamela looked at her. "Am I in trouble?" "I don't know," Audrey said honestly. "But if the call was what you said it was, saying it clearly and early is better than saying it later." Pamela nodded. She held her tablet against her chest and looked at Audrey with an expression that was trying to find a framework and wasn't finding a comfortable one. You were here all night. It's my shift. You were... She stopped, started again. I've been telling the float nurses where to go and what to restock for 11 years. You've been here too. Yes. I didn't know. I know you didn't. It wasn't absolution. It wasn't forgiveness. It was just a fact, and Audrey delivered it as a fact, because the accurate accounting of things was what the night had been about from the beginning, and she saw no reason to abandon the practice now. Pamela went to find Tark. At 5:40, Tark sat down with Audrey in the same conference room where Hale had confronted her 8 hours earlier. The motivational poster about teamwork was still slightly crooked. The folding table was the same. The difference was Tark across from her with a federal case file and a recording device, and the specific quality of attention that Audrey had been giving patients all night, focused, unhurried, interested in what was actually there rather than what was expected to be there. Tark walked her through Arden Valley. Not everything. There were clearance levels involved, and there were things that were in the case file that Tark clearly wasn't going to surface in this room. But enough. The operation had involved a contractor network acting on intelligence that was later found to be manipulated. The outcome had been 3 civilian casualties and 2 team members wounded. The after-action report should have reflected the compromised intelligence as the causal factor. Instead, the report was rewritten to attribute the outcome to field medical decisions, to Audrey's decisions. The original report, Tark said, was filed by the team lead at the time, Captain Bannon. I know. It was accurate. It cleared your decisions completely. It attributed the outcome to the intelligence failure and named the contractor network as the compromised source. I know, Audrey said. Bannon told me last night what he filed. What you didn't know, Tark said, is that the original report was intercepted and modified before it reached the review board. Bannon filed an accurate report. What the review board received was a different document. She paused. Bannon spent 14 months trying to prove his original report existed. Carter was with him when he filed it. Carter's files contain a time-stamped copy of the original. Audrey was quiet for a moment. She thought about the review board and what she'd been told it said. She thought about the weight of having been told that she was the variable, the adjustable piece, the one whose record could be rewritten because she was a medic and not a contractor asset, and not an officer with the institutional gravity to push back. She thought about 2 years of pushing a cart and restocking gloves and making herself the most invisible person in every room she walked into. She thought about the specific shape of choosing to be no one. The modification, she said. Who ordered it? Hale is one node in a chain, Tark said. He had the institutional position to make the modification credible, and he had access to the personnel system. But the authorization came from above him. She set a single document on the table. The individual at the top of that chain is a senior oversight official at a federal contractor organization. His name is in the file. He's been under parallel investigation for 11 months. She tapped the document. Tonight gave us the operational link we were missing. Hale's recorded admission plus the server logs plus Carter's files. That's the chain complete. Audrey looked at the document. She didn't pick it up. What does this mean for my record? She said. The modification will be reversed. The original Bannon report will be entered as the official after-action record. Your service file will reflect your actual performance and your actual history. Tark paused. That process begins today. Audrey heard it. She let it come in without rushing it, without reaching for it, just let it arrive in its own dimensions. And the 6 personnel files, she said. The others. Tark looked at her. Something in the agent's face moved, the first non-precise expression she'd shown since arriving in the recovery bay. The same process, all 6. Some of them left the service because of what was written about them. Yes. Can that be undone? Tark was quiet for a moment. The record can be corrected. What the record cost them? She stopped. That's a different question. I know, Audrey said. I'm asking anyway. There will be remediation processes. It won't look like what was taken, but there will be something. Tark gathered her file. I want you to know that the work you did in this building tonight, the decisions you made, the way you managed an active threat environment while maintaining patient care, that's also going in the record. I'm a nurse. It's my job. Your job description does not include neutralizing a hostile actor in a server room with a cable management arm. I didn't neutralize. I interrupted him. Tark almost smiled. It was a small and controlled almost smile that fit her face precisely. The distinction has been noted. She stood. I'll need you available for follow-up over the next several days. You can give Agent Morales your contact information. I work here, Audrey said. I'm not hard to find. Tark nodded and left. The conference room held the specific quality of a room after a significant conversation has ended in it. Not empty, but altered. Audrey sat in it for 2 minutes, which was not long, but was the amount of time she needed. Then she went back to work. The morning shift was coming in. The day nurses arriving in their clean scrubs with their coffee containers and their pre-shift conversations, moving through the hallways with the ordinary momentum of a hospital beginning its day. They passed federal agents in the corridors and managed this with the specific resilience of medical staff who have learned that a hospital is a place where extraordinary things happen inside ordinary infrastructure, and you learn to navigate both simultaneously. Audrey completed her documentation. She was thorough. The night's events had generated more chart entries than most shifts produced in a week, and she wrote them all with the same specificity she brought to everything: times, vitals, interventions, responses, personnel present. The incident reports would follow separately, but the chart was the primary record, and the primary record should be exact. At 7:10, Dr. Nwoll arrived for the day shift. She found Audrey at the nursing station finishing the last of the documentation and stopped and looked at her with the expression she'd been developing since the moment she'd listened to Dottie's chest and found what Audrey told her would be there. I've been hearing things, Nwoll said. There will be a formal briefing. You were here all night. It's a 12-hour shift. Nwoll looked at the recovery bay, at the agent still in the corridor, at Doyle, who had finally accepted transport and was gone, at Carter in Bay 12, vitals steady, breathing independently, showing every sign of a man whose body had decided to stay. The patient in 12, she said. You placed his chest tube. Needle decompression first, tube second. I know the sequence, Nwoll said, and there was something in her voice that was different from the voice she'd been using since the beginning of the shift last night, different from the careful patience she'd applied to Audrey's assessment of Dottie, different from the efficiency with which she'd called the OR. This was something more direct. I've been in medicine for 5 years. I don't have your hands. Audrey looked at her. I mean, technically, Nwoll said, under pressure. The way you moved in there last night. I've seen attendings with 15 years who don't have that. You went to get the tray? Audrey said. When Hale was standing there, you went. Nwoll was quiet for a moment. Someone had to. Yes. They looked at each other for a moment across the nursing station. 2 people who had been in the same room under significant pressure and had each made the available decisions and were now, in the ordinary light of a Thursday morning, taking an accurate reading of each other for perhaps the first time. At 7:30, Audrey's shift officially ended. She logged out of the charting system. She gathered the things she'd brought in, her badge, her pen, the pen light in her scrub pocket. The same things she'd come in with. The supply cart was restocked. The charts were complete. The documentation was exact. She walked through the recovery bay on the way out. Carter was awake, fully awake this time, the anesthesia cleared, his eyes open and tracking. Bannon was beside his bed. They were talking in low voices, the specific quality of conversation between people who have been in things together and are now doing the accounting. Carter saw her. Hey, he said. His voice was still raw but functional. Hey, she said. They said I'm off the vent. Since 3:50. You did a 22-minute spontaneous trial. He looked at her. You stayed for that. I was on shift. He looked like he wanted to say something more and didn't have the energy for the version that was accurate, so he didn't say the lesser version. She respected that. She kept walking. In the corridor, Tark was speaking to one of her agents and looked up when Audrey passed. She gave a small nod, precise and sufficient. Audrey nodded back. She took the elevator down. She walked through the main lobby, which was beginning the particular morning transition of a hospital lobby. The night stillness giving way to the arrivals of the day, families coming, administrative staff behind the desk, the volunteer with the information cart setting up. Ordinary. The specific ordinary that is only possible because of everything that happens in the parts of the building that the lobby doesn't show. She pushed through the main doors. Outside it was early morning. The parking lot was pale with the specific light of a day that hadn't fully committed yet. Her car was where she'd left it, which felt like information from a different world. She stood on the sidewalk in her scrubs with her badge clipped to her pocket, in the morning air doing what morning air does, which is arrive without ceremony and without regard for what has preceded it. Her phone rang. She looked at the screen. The number was one she didn't recognize, with a Washington area code. She held it for 2 rings. On the 3rd ring, she answered, Voss. The voice was male, authoritative without performing authority. The voice of someone who occupies a level of institutional hierarchy where performance is not required. My name is Director Callum Reese. I'm with the Office of Special Operations Review. She waited. I've been briefed on the events at Northbridge Medical Center overnight. I've also been reading your original service file this morning, the unmodified version. A pause. I'd like to have a conversation with you. About what? She said. About what comes next, he said. For you, and for several other things that your file suggests you're better positioned to address than anyone currently in the room. Audrey stood on the sidewalk outside Northbridge Medical Center in the early morning light and held her phone and thought about what came next. And underneath the thought there was something that was not quite what she expected. Not the relief she'd anticipated. Not the clean resolution of a thing that had been wrong for 3 years. Instead, there was something more complicated. Something that had to do with the fact that a record being corrected was not the same as the years being returned. That the file could be accurate and the cost still real. That she had spent 2 years making herself invisible and had done it well enough that when she stopped, when the doors blew open and a name echoed across the trauma bay, and her hands found the work they'd always known, the revelation had landed in that room like the reveal of something that had been there all along, which was true, and which was the hardest part. Director Reese, she said. Yes. I want the other 5 files corrected first. She looked at the hospital, at the building that held Carter and Bannon and Tark and the work that wasn't finished. All 6 of us before anything else. A pause on the other end. Not a surprised pause. The pause of someone recalibrating their read of a person. That's already in motion, he said. Then we can have the conversation. She looked at her car. Not today. I need to sleep. Of course. Another pause. Ms. Voss? Yeah. What happened last night in that hospital? The decisions you made, the way you managed it. We've been trying to build a case for 14 months. You held the evidence intact and the witness alive in a single shift. His voice was level. I want you to understand that the people I answer to are aware of what that means. Audrey heard it. She let it sit where it landed without reaching toward it or pushing it away. I'll call you when I've slept, she said, and ended the call. She stood there for another moment. The morning was arriving with its complete indifference to her. A bird somewhere in the parking lot hedge was making the sound birds make at that hour, which is a sound that contains no information about the night that preceded it. A car turned in from the street and moved toward the parking structure, somewhere above her, on the 4th floor, behind the glass and the clinical white of a recovery bay. Carter Hale was awake and talking to Bannon with the specific quality of attention of a man who is still figuring out how to be alive. She unlocked her car. She got in. She sat for a moment with both hands on the steering wheel and the engine not yet running. She thought about Tark saying the record would be corrected. She thought about Reese saying all 6 files. She thought about the 29% of a server log that was going to become, in the hands of federal forensics, the thread that pulled a contractor network apart. She thought about Carter's hand in Bay 12, the involuntary curl of fingers toward something to hold. She thought about Nwoll going for the chest tube tray when Hale was standing there. She thought about Doyle, with a cut on his head, saying I'm fine in the specific voice of someone who was not going to pretend otherwise. She thought about the supply cart. 2 years of a supply cart, and it had done what she needed it to do, which was hold her upright and invisible in a place where she could be reached when being reached was necessary. She thought about none of this being clean, about Reese's voice saying what comes next, and the fact that she didn't have an answer for that yet, and wasn't sure the answer she'd been assembling for 2 years was still the right one. She thought about 6 personnel files, about 5 people she didn't know whose records had been written wrong, and who had been living, in whatever form, inside the version of themselves that someone with institutional authority had manufactured because it was convenient. She started the car. Her phone buzzed. Not a call. A text from a number she didn't have in her contacts, sent from Bannon's phone. She recognized the last 4 digits from when he'd called Tark. It said, "Carter wants me to tell you the 22 minutes." She looked at it. The 22-minute spontaneous breathing trial. The one she'd stayed for at 3:50 in the morning when Carter had breathed on his own for 22 minutes and proved that his body had decided to stay. He'd been sedated. She'd thought he was under. He hadn't been fully under. He'd known she was there. She put the phone down. She pulled out of the parking spot. She drove out of the Northbridge Medical Center parking lot in the early morning light, and she was not crying. She was not the kind of person who cried from that specific stimulus. It had been trained or lived out of her years ago. But something in her chest was doing something that didn't have a clean clinical name, something that had to do with being seen after a long time of choosing not to be. She drove. 3 blocks from the hospital, at a red light, her phone buzzed again. Same number, another text. It said, "Also, Tark pulled Hale's personnel file this morning. Full background. He has a brother." She looked at the text. His brother is the administrator on call that Gorch phoned last night. Audrey stared at the screen. The light changed. The car behind her waited 1 polite second and then made its quiet objection. She didn't move. The administrator on call. The person Pamela Gorch had called as protocol. The person whose name had meant nothing to Audrey when Pamela said it. The relay point through which Carter's location had moved from the hospital system into the hands of the people outside. Not Hale accessing the system directly. Hale's brother receiving a protocol call from an unknowing charge nurse, extracting the information, and passing it to the network. 2 brothers, one with a white coat and a trauma fellowship and a credential that accessed surgical scheduling. One with an administrator title and a duty phone and the ability to receive information from a charge nurse who was just following protocol. Audrey looked at the text for 3 more seconds. Then she put the car in park, right there at the intersection, and called Tark. Tark picked up on the second ring. "The administrator on call last night," Audrey said. "What's his full name?" A pause. Papers moving. "Douglas Hale. Why?" There it was. And simple and devastating in the way that simple things are devastating when they are also true. 2 brothers, 1 institution, and a charge nurse who had been following protocol her entire career and had never once considered that protocol could be weaponized by the people who designed it. "He's Victor's brother," Audrey said. The silence on the other end was 3 seconds long, which for Tark was the equivalent of a sharp intake of breath. "Where are you?" Tark said. 3 blocks from the hospital, sitting at a green light." "Come back." Audrey looked at the intersection. She looked at the early morning street, at the ordinary Thursday beginning to populate itself with ordinary people driving to ordinary things. She thought about the sleep she needed, and the bed that was waiting, and the specific physical cost of a 12-hour shift that had included a server room and a recovery bay, and a cable management arm, and a conversation with a federal director at 7:30 in the morning. She turned the car around. When she walked back through the Northbridge main doors 11 minutes later, the lobby had shifted further into its day configuration. More people, more noise. The information volunteer fully set up, 2 families at the reception desk. She moved through it in the same scrubs she'd come in wearing the night before, badge still clipped, and nobody stopped her because she looked like what she was, a nurse who belonged in this building. Tark was in the 4th-floor conference room with 2 of her agents and a phone on speaker and a face that had reorganized itself around the new information with the efficiency of someone who processes structural changes to a case quickly and without visible distress. Douglas Hale had been the Northbridge Medical Center administrator on call since January. He had been appointed through a board vote that, when Tark's team pulled the records in the next 40 minutes, would show that 3 of the 5 board members who voted for his appointment had documented connections to the same contractor network that had employed the men in wrong scrubs and the man with the medication tray. The appointment had been placed 14 months ago, 1 month after Carter Hale's team had started making noise about what they'd seen at Arden Valley, 2 months before Bannon filed his accurate after-action report that then disappeared into a modification process and came out wrong on the other end. None of this was coincidence, all of it was architecture. "They put him in place," Audrey said. She was standing at the window of the conference room, looking at the parking lot below. Before they knew Carter was going to end up here, just as a node, a relay point in the system. "That's how these networks operate," Tark said. She was on her phone, but she was listening. "You don't build the infrastructure after you need it. You build it when you have time, and you leave it dormant until it's useful. And Gorch's call activated it. Without Gorch knowing anything was wrong, Tark finished her call and set the phone down. Douglas Hale is currently at home. He doesn't know we have his brother or that we have the access logs. She looked at Audrey. We have about a 90-minute window before someone in the network realizes what happened last night and makes a call to warn him. Then you have 89 minutes. Tark was already moving. Audrey didn't go with her. That part wasn't hers. She had given Tark the thread and Tark knew what to do with it. And the appropriate thing now was to step back and let the institutional machinery do the work it was designed to do. She had spent the night making decisions in the space where the machinery had failed. The machinery was functioning now. She could step back. She sat in the conference room alone for a few minutes. The motivational poster was still crooked. She thought about straightening it and decided it had earned its angle. At 8:40, she went to check on Carter one more time. Not because it was her shift had ended 70 minutes ago, but because she was in the building and he was there, and the continuity of care is a real thing that exists independent of shift schedules. He was sitting up. Not far. The surgical team would have strong opinions about how far, but the head of the bed was elevated and he had a cup of ice chips that someone had brought him, and his color was the color of a person who had made it through the night and was taking careful stock of that fact. Bannon was gone. His team had been there when Audrey arrived and would be returning. They had logistics and Reyes and the formal debrief that waited for them somewhere in the federal apparatus of the morning. The room was Carter and the monitor and the specific quiet of a recovery bay in the day shift, which was different from its night quiet. More movement outside, more voices in the corridor, more of the ordinary noise of a hospital being a hospital. Carter looked up when she came in. "You came back," he said. "I forgot to check your drain output before I left." She checked it. The numbers were what she expected. She wrote them down. He watched her do it. "Is that actually why?" She capped the pen. "The drain output matters." He almost smiled. It cost him something to almost smile. She could see it in the tightening around his eyes, the remnant of the night's toll, but he made the investment. "Bannon told me what you did," he said. "The server room." "Bannon tells you a lot of things." "He doesn't, actually." Carter held the cup of ice chips with both hands, looking at it. "He's not a man who tells people things. He told me about you for 3 years. Every time things got, when the investigation stalled, when another lead went cold, he'd say the same thing. He'd say Beacon is out there and when we need her, she'll be there." He looked up. "I thought that was the kind of thing people say when they don't have anything useful to say." "It usually is," Audrey said. He was right, though. She looked at him. He looked back. The monitor kept its rhythm between them, the steady language of a body that had chosen to continue. "The 22 minutes," she said. "I could hear you," he said. "I wasn't all the way under. I could hear the ventilator, and I could hear you moving around the bay, and I could hear, I don't know, the way someone moves when they're staying on purpose." She didn't say anything. "That's when I knew," he said. "I'd been trying to figure out all night if you were the same person Bannon described, or if he'd built you into something in his head the way people do when they need something to be true." He set down the cup. "But that's when I knew." "What did you know?" "That you weren't going anywhere." She looked at him for a moment. She thought about the things she could say in response to that, and the things that were true in response to that, and the distance between those two sets. She settled on the version that was honest without being more than she had the energy for right now. "Get some rest," she said. "You've got a long debrief ahead of you." "I know." He leaned back. His eyes were already getting heavier. "Voss." "Yeah. Thank you." A pause. "Not for the chest tube, for the 22 minutes. She picked up the chart. "Document it with Tark when you're cleared. Everything you have. Don't leave anything out." "I won't." She left the bay. In the corridor outside recovery, Dr. Nwoll was coming out of a patient room and stopped when she saw Audrey. "Your shift ended," Nwoll said. "I know." "Are you coming back tonight?" Audrey looked at her. It was a straightforward question, the kind of question a colleague asks another colleague, and the word colleague was the part of it that registered as new, not the float, not the night nurse. A colleague. "Probably not tonight," Audrey said. "I need to sleep first." Nwoll nodded. Then, "What you said last night, in the bay, to Hale." She paused, choosing the next part carefully. When you said you didn't need permission to save a life, I've been thinking about that. Don't make it into a speech, Audrey said. It wasn't a speech. I needed the tools. I know it wasn't a speech, and Wool held her chart against her chest. That's why I've been thinking about it. They stood in the corridor for a moment in the kind of silence that isn't uncomfortable, that is just two people in close proximity to a shared experience that hasn't fully resolved itself into language yet. I should have gone for that tray faster, Wool said. Last night, when Hale was standing there, I should have moved the second you asked. You moved. Not fast enough. Fast enough is relative to outcome, Audrey said. Carter is upstairs with ice chips. You moved fast enough. Wool looked at her for a moment. Something settled in her face that had been unsettled. She nodded once, the nod of someone filing something away in a place they'll be able to find it later. See you when you're back, she said, and went down the corridor. The formal press briefing happened 11 days later. Audrey was not in it. She had no desire to be in it, and Tark had not required her presence. And the events of the briefing reached her through the same channels they reached anyone who was paying attention. News coverage, a call from Bannon, a text from Carter, who was by then ambulatory and in a DoD medical facility 3 states away going through the debrief process that would take 6 weeks and reshape several things. Douglas Hale had been arrested at his home at 9:14 a.m. on the morning after the events at Northbridge, 73 minutes after Audrey had called Tark from the intersection. His phone records confirmed 14 months of contact with the contractor network through an encrypted relay. The morning of the Northbridge admission, he had received a call from a number connected to the network 40 minutes after Pamela Gorch's protocol call had informed him of the unusual military admission. He had made 3 calls in the following 20 minutes. Those calls had set the night's events in motion. Victor Hale was formally charged 8 days after his arrest. The charges were multiple and specific and included obstruction, unauthorized modification of federal military records, conspiracy, and 3 counts related to the events of the night at Northbridge. His recorded admission in the recovery bay, Bannon had been transmitting, not merely recording, the feed going live to Tark's team, who had been 12 minutes out when Audrey and Bannon came up the south stairwell, was entered into evidence and was, by every account that Audrey received, conclusive. His trauma privileges at Northbridge were suspended the morning after his arrest. The hospital board voted to terminate his contract at an emergency session 6 days later. Audrey learned this from Fenn, who called her on her day off with the particular tone of a man delivering information he considers significant and is watching to see how it lands. He's gone, Fenn said. Formally, the board voted 7-0. Okay, she said. A pause. I thought you'd want to know. I did want to know, she said. Thank you. Audrey. He stopped. She waited. Fenn was a careful man who chose his words with the deliberateness of someone who had learned that imprecise words in medical contexts cause specific harm, and he applied that standard to personal conversations as well, which made them slower but more accurate. I've been here 12 years. I've worked with a lot of people on that floor. I want you to know that what you did last night, what I've been learning in the days since about what you did that night and what it actually required, I should have paid closer attention. 2 years ago. You weren't in a position to know. I could have asked. Yes, she said. You could have. It wasn't forgiveness and it wasn't accusation. It was just the accurate answer. And Fenn, being who he was, received it as such. The hospital wants to offer you a permanent position, he said. Trauma. Full-time. Day or night. Your choice. The chief nursing officer is going to call you formally, but I wanted to say it first. A pause. I wanted to say that I hope you take it. She looked out the window of her apartment at the street below that she had been looking at for 2 years without much investment in what she saw. Ordinary street, ordinary Thursday. The same one that had been there the morning she'd driven home from Northbridge in her scrubs, except that it looked different now in the way that things look different when you are looking at them from a different position inside yourself. I'll think about it, she said. She thought about it for 4 days. She thought about the supply cart. She thought about 12-hour shifts on every floor of a building where people knew her as the float and nothing more. And she thought about whether the thing that had kept her in that arrangement for 2 years was caution or was something else. Something smaller and less defensible. Something that looked like self-protection from the inside and looked like self-erasure from the outside. She thought about Noel in the corridor saying, "See you when you're back." She thought about Carter's 22 minutes. She thought about the 5 other people whose files were being corrected. She had learned their names through Tark's office in the week following. A logistics specialist from Nevada, a communications officer who had gone into private sector work in Colorado, 2 field medics, and a helicopter pilot from Oregon who had left the service and was now teaching at a community college. 6 people with the same wrong story written over their real one. 5 of them she didn't know. One of them was her. And the correction of those files would matter. It would matter for clearances and pensions and records and the formal accounting of what a person had actually done with the years they'd spent. But the correction was not the same as the years. The correction was accurate, but it was not retroactive. You couldn't give back a morning. What you could do was make different decisions in the mornings that remained. She called the chief nursing officer on the 4th day. She took the position. The first shift back, a Tuesday. She came in at 7 a.m. for the day rotation, which was different from the night, busier, louder, more people in the corridors, more decisions happening simultaneously, the trauma floor at full operational capacity. She got her assignment from the charge desk. Not from Pamela Gorch. Pamela had taken a 2-week leave following the events of the night, and when she returned, she was quieter in a way that was not performing quietness, but was the genuine article, the quietness of someone recalibrating their instruments. The assignment came from a day shift charge nurse named Lenny, who handed Audrey the paper face up without any particular significance attached to the gesture, which was the most significant thing about it. She worked. She worked the way she had always worked, which was thoroughly and without ceremony, and the difference was that people saw it now. Not because she had changed, but because the context had changed around her, the way a painting changes when the lighting in the room changes. The same object, different visibility. Enwol consulted her on a patient assessment at 9:15. One of the third-year residents, Park, who had been in the trauma bay the night Carter arrived, asked her about a chest auscultation finding with the directness of someone asking a peer rather than deferring upward. A new admit came through at 11:40 with a presentation that the attending was reading one way and Audrey was reading another way, and she said so, clearly and without hedging, and she was right, and the attending thanked her without it being a thing. That was the difference. It was not dramatic. It was just the ordinary texture of being accurately perceived, which turned out to feel different from anything she had a word for. At 2:30, Bannon appeared in the trauma floor corridor. He was in civilian clothes. Actual civilian clothes this time, not the rushed version from the night of the operation, but the genuine article, jeans, a plain jacket, the look of a man who exists outside of uniform and is comfortable in that existence. He had a small package under his arm. He looked less exhausted than the last time she had seen him, which was not the same as rested, but was an improvement. She met him in the corridor. "You're working days now," he said. "Apparently." He held out the package. It was small, flat, wrapped in nothing more elaborate than a paper bag folded closed. She took it and opened it because he was clearly waiting for her to open it. Inside was a badge. Her military ID from the other life. The photograph taken in the 2nd year of her service. Her face in it younger and more angular and carrying the specific look of someone who has just learned things they will spend the rest of their life processing. The badge had her name on it, her rank, and below her name, in the designation field, Echo 6, Beacon. She looked at it. "How did you get this?" "It was in the original personnel file," he said. "The unmodified one. When Tark's people reconstructed your record, it was in the attachment index. They released it to me 2 days ago." He paused. "I should have been able to give it to you 3 years ago." She held the badge and looked at the photograph. The woman in it was someone she knew well and had been trying not to be for a significant portion of the intervening years. And she thought about what Carter had said about Bannon, that he wasn't a man who told people things, except that he had told Carter about her for 3 years. Every time a lead went cold, every time the investigation stalled. She thought about the particular act of being held in someone's accurate memory when you are trying to be nobody. The specific weight of being known by someone who refused to participate in your disappearance. "Bannon," she said. "Yeah." "Arden Valley." She looked at him directly. "The original report you filed, the one that was modified." "Yes." "Did you know what it cost me when it came back wrong?" He held her gaze. "I suspected. I didn't know the extent until Tark's team reconstructed the file. What did you do when you suspected? He was quiet for a moment. I kept filing. I kept pushing. I wasn't fast enough. His voice was level, and she could hear in its levelness the specific quality of a man who has been accurate with himself about something and hasn't forgiven himself for it, and isn't asking her to do it for him. I'm not asking you to say it's okay. I know, she said. I'm not going to. He nodded. But I'm still here, she said. And you're still here. And Carter's in Maryland doing his debrief, and 5 other people have their real records back, and the contractor network is going to spend the next several years being very carefully taken apart by Tark's office. She looked at the badge. That's not nothing. No, he said. It's not nothing. She looked at the badge for a moment longer, the photograph, the name, the designation. She put it in her scrub pocket. Bannon looked at the pocket and then at her. Something moved in his face that she recognized, the same thing she'd seen in Carter's face in the recovery bay, and in Wool's face in the corridor, in Fenn's voice on the phone. The specific expression of someone looking at a person they have been seeing incorrectly and correcting for it in real time, the slight recalibration of a lens. What happens now, he said. For you? For you. She thought about it honestly, which was the only way she thought about things. I work here, she said. I'm good at it. There are people on this floor who are going to make better decisions because of what happened 9 days ago, and some of those decisions are going to matter to patients who will never know any of this. That's not a small thing. She looked down the corridor. The trauma floor in full-day operation, the ordinary movement of medicine being practiced in real time, imperfectly, consequentially. And Reese's office called again yesterday. What do they want? To consult on some things. She paused. On how to build systems that don't fail the way the Arden Valley system failed. On what that kind of failure looks like from the inside of it. She shrugged, a small gesture that was honest about the ambivalence inside it. I don't know yet. I told him I'd think about it. That seems like something you'd be good at. I'm good at a lot of things, she said. The problem was never what I was good at. Bannon almost smiled. It was the kind of smile that doesn't perform itself. No, he said. It wasn't. He left. She watched him go down the corridor, the same corridor she had watched Hale walk down 6 months ago and Tark walk down 9 days ago, the corridor that was just a corridor and was also the entire territory of everything that had happened here. He turned the corner and was gone. She stood for a moment. Then she went back to work. She went back to work because that was what she had always done, in every environment she'd inhabited, field or hospital or the 2-year borderland in between, and the continuity of that was one of the only things she trusted about herself. Not her judgment, which she'd seen fail. Not her instincts, which were good but not infallible. Not the people around her, who were trying their best and getting it wrong at predictable intervals. Just the work itself. The next patient. The next assessment. The next thing that needed to be done accurately by someone willing to do it accurately, regardless of whether anyone was watching. The badge was in her pocket. She didn't take it out again that day. She didn't need to. The point wasn't to carry it. She had been carrying it for years without having it, which was the whole architecture of the thing, the reason someone had taken it away. The point was that it was accurate, that the name on it was the correct name for the person who worked this floor and held the chest tube tray and stayed for 22 minutes and locked the service corridor door and told a federal agent which stairwell the threat would use. The point was that the record and the person now matched. Here's what Audrey Voss learned. Not in the trauma bay on the night the doors blew open, but over the weeks that followed, in the ordinary return of ordinary shifts. The most dangerous thing a system can do to a person is convince them that being invisible is the same as being safe. It isn't. Invisible is just a version of gone, and gone people cannot do the work that only they are positioned to do. They cannot catch what others miss or hold what others drop or stand at the border between a fragile life and the thing coming for it and decide, without hesitation, to hold the line. She had spent 2 years being gone. It had not kept her safe. It had only deferred the moment when the doors blew open and the room required what only she had. The room will always require what only you have. The only question is whether you'll be standing there to give it or whether you'll be beside a supply cart holding a box of gloves, making yourself small, waiting for someone to say your name. Someone will say your name. The only thing that matters